Thank you.
Good afternoon and welcome to the Senate Judiciary Committee hearings dated January 19th, 2022. We're going to open the public hearing on Senate Bill 399, but before we do that, there's a couple things that I'd like to just talk a little bit about. First of all, as you can tell, there are a lot of people here today that are on both sides of the issue, and I would ask you all to be very respectful of each other. That means no clapping, no high-fiving, no going yay, 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 or any of those things. And conversely, on the other side, no boos, no thumbs down, no making faces, those types of things. We are very, very respectful in this chamber, and we expect the people that are going to be coming to speak to us to be equally as respectful. Second of all, we have so many people here that really would like to testify. So to ensure that everyone here who wants to speak has an opportunity to speak, we're going to limit everyone to 3 minutes except for the prime sponsor of the bill. So please be very concise in what you want to tell us, what you want to speak to, because again, it's not about cutting you short, it's ensuring that everyone has an opportunity to address us. As you know, we have another bill after this so ensure that we all receive a copy of it. These bills are not being execed today. So I want to make sure that all the committee members have an opportunity to read all your emails and all the things that you would like us to consider before we vote on this bill. I would also ask you, please, do not repeat testimony that we've already heard. We're interested in hearing new things, so please be cognizant of that when you testify in front of us. Okay? So that being said, I'm going to recognize the prime sponsor of Senate Bill 399, Senator Rosenwald. Welcome to Senate Judiciary.
Thank you, Madam Chair. For the record, I'm Senator Cindy Rosenwald, and I represent District 13 in Nashua. Today, I'm here as a prime sponsor of Senate Bill 399 to repeal the 24-week abortion ban and ultrasound mandate that were inserted into the last budget. Before I discuss the legislation, though, I just want to briefly give some context to today's hearing. We all know that New Hampshire's COVID case rate is the highest in the country, and our hospitals and ICUs are full. Under normal circumstances, medical professionals would be here to testify in person, but they're currently occupied taking care of patients, and I didn't feel I could in good conscience ask them to abandon those responsibilities. But I did check, and that as of just before noon, 1,662 people had registered their comments and their support of this legislation, representing about 65% of the total sign-ins. So, Madam Chair, I don't think I would be wrong in saying that access, and I truly respect your right to hold that opinion. But for the majority of Granite Staters who do not share your opinion, what right does the government have to tell women what they can and cannot do with their bodies? And I'd like at this moment to read you part of an email I received yesterday from Rabbi John Spiros Savat, who is the rabbi of Temple Beth Abraham in Nashua. I'm not going to read the whole thing because some of it's not relevant to this bill. I want to convey that as a Jew and a Jewish heart of abortion rights, in the Jewish religion, abortion is not murder, and a fetus, while sacred, is not a person in the same legal sense. New Hampshire law, as currently stands, and the refusal to fund women's health service contracts amount to a restriction on the freedom of religion for Jews and an impingement on my ability to counsel people at really difficult times. And at the end of the day, Madam Chair, I believe this bill is about individual bodily autonomy. The current ban in New Hampshire law does not carve out exceptions for rape or incest. It tells a woman that her body is not her own, but instead is just a vessel to carry the result of her assault. I've heard the argument that 24 weeks should be enough time to make that decision, but I think we need to remember that 41% of reported sexual assaults happen to victims under the age of 18. And in fact, almost 800 children were served by the New Hampshire crisis centers. So let's recognize the reality that not every sexual assault survivor has easy access to care. The ban does also not include exceptions for fatal fetal anomalies. It tells a pregnant woman who just discovered that her baby will not survive that she is not capable enough, not caring enough as a parent to make what she believes is the more loving choice between terrible choices. During the initial hearing on House Bill 625, which inspired the language put into the state budget, we repeatedly heard testimony from medical professionals that every pregnancy is unique. And we heard from doctors how only 1% of abortions take place after 21 weeks and are often linked to an inability to diagnose all fatal fetal anomalies earlier in pregnancy. Doctors told the legislature directly that criminalizing doctors will only exacerbate our healthcare workforce shortage and disincentivize doctors from coming to work in New Hampshire. I just can't imagine threatening a doctor with 7 years in prison for providing the necessary care in their patient's best interests that their ethics guidelines require them to give. Such restrictions create a barrier between women and their doctors in the most heartbreaking and personal circumstances. But they are the only people qualified to make that awful decision and the only ones who deserve that right. The ban signed by Governor Sununu includes mandatory ultrasounds to determine gestational age, even when a woman has just learned she is pregnant and ultrasound is unnecessary. For a sexual assault survivor, that means she may feel her body is to be unnecessarily violated once again, so that government officials can feel comfortable in knowing they forced someone to, in the words of one of our House colleagues, connect to the baby that's inside of her. And then government officials will force her to cross the financial barrier of copays and deductibles for care she neither needs nor wants. I have heard the phrase abortion for convenience repeated by some of my colleagues during discussions of this issue, and I take offense to that. This world, and you will never be able to experience the fear, heartbreak, agony, or perhaps moral confusion if you're a pregnant sexual assault survivor. You will never hear the phrase, "Your baby will not survive," and feel that your body has failed you and you have failed your child. So please, let's not confuse the choice to have an abortion later in pregnancy as something done out of convenience, because it is not. So today we're at a crossroads. As a state, do we respect a woman's right to choose? Or do we tell New Hampshire women that our state value of individual freedom does not apply to them? Thank you, Madam Chair.
Thank you very much for your testimony, Senator. Are there any questions from the committee? Okay, Senator Whitley and then Senator Gannon.
Thank you, Madam Chair, and thank you, Senator Rosenwald, for bringing this bill. So, in addition to hearing from the governor and others about this bill, they indicate, look, there are 24-week bans in a lot of places, but I'm curious what makes ours different than the other locations that do have a 24-week ban.
I'm sorry, it was kind of hard to hear you.
So I'm curious, our abortion ban has been likened to other states, saying so many other states have a similar abortion ban. But I'm curious your thoughts about what makes ours different than the other states that do have a 24.
Oh, thank you. Ours really has very limited exemptions, and other states have broader exemptions.
Senator Gannon?
Thank you, Madam Chair. Thank you, Senator. Your nice testimony. Question for you. One is, at the beginning of your testimony, you said, what right does the state have? I've been brushing up a little on Roe, and I was just listening to Sarah Weddington, who was the attorney for Roe, and what I got out of it and what seemed to be at 24 weeks or viability, that's what Roe is. Am I wrong in my understanding that Roe said at 24 weeks the state has a compelling interest at that point?
Well, 24 weeks doesn't always mean viability. Every pregnancy is unique. Viability is a moving target, and there's no test for viability. So 24 weeks is a very arbitrary ban. If you were pregnant and it was the first day of your 24 weeks, if you went to the doctor and were told that horrible, devastating news of you're not going to have a baby that can survive, you would not be able to terminate that pregnancy, even given the most up-to-date medical information your doctor, who's responsible for your care, can give you.
Quick follow-up.
Follow-up?
There have been children born now with medical advances at 21 weeks. So in my mind, I see 21, you'd go with the safest point of when the earliest life. And so we've born children with medical advances. So I might be in that, but my question for you would be, when do you consider an unborn child a person? When would it have rights on its own, in your opinion?
Even doctors don't know when life begins. I'm not a doctor. I was an English teacher. Before that, I was an advertising executive, so I try not to second guess the medical professionals.
Quick follow-up, final follow-up.
Follow-up?
So, but you're asking for us here to go right up to birth to allow an abortion. So you are giving your opinion, so that's why I'm going to press you a little more. Where you're asking to go, you have no age cutoff, like at 25 weeks, 35 weeks, 40 weeks. Is there a cutoff for you ever?
I think that to suggest that abortions are done up to the moment of birth is inflammatory, but not based in the reality of medical practice. Any physician will tell you that's just not how abortion care works. But what this ban does do is take away options for women who find out devastating news later in pregnancy.
Thank you.
Okay. Are there any further questions? Seeing none, thank you very much, Senator. The chair will call Senator Donna Soucy. Senator, we're going to, because we have so many people who would like to testify, we're going to do the 3-minute thing. So
Very good.
thank you. We want to make sure everyone has an opportunity.
I will be certain to be succinct. Thank you very much, Madam Chair, members of the committee. For the record, I'm Donna Soucy. I represent Senate District 18, comprised of Manchester's wards 5 through 9 in the town of Litchfield, and I'm here today testifying in support of Senate Bill 399. In particular, I want to focus your attention not on many of the arguments that we've all heard about this bill, but provide some context on reproductive health care in New Hampshire today as we stand here and consider this legislation. Right now, 3 family planning centers, Equality Health, Lovering Health Center, and Planned Parenthood, have had their family planning contracts rejected 3 times in the past 5 months by the majority on the Executive Council. These contracts have been rejected despite the governor's repeated request that they be passed, and despite the fact that DHHS has provided comprehensive financial reporting that clearly proves no state dollars are being used to fund abortion care. Earlier this very week, Governor Sununu sent a letter to the members of the House Health and Human Services Committee, urging them to support House Bill 1609, which would have addressed some of the cruelest parts of the abortion ban, including making an exception for cases of rape or incest, making exceptions for fetal anomalies incompatible with life, and making an exception for the health and life of the mother, and removing mandatory ultrasound requirements. In his letter, he stated, "We must ensure that access to services remains safe and accessible in the Granite State during what is a rare but extremely difficult and stressful time for women and their families." Instead of making these changes, as recommended, as supported by many, the Health and Human Services Committee instead stripped the bill and removed everything but repealing the mandatory ultrasound requirement. In the House, there are other bills that have been filed to prohibit abortion after detection of a fetal heartbeat, to allow biological fathers of an unborn child to petition the court, and on and on. Reproductive health care continues to be under attack here in New Hampshire and across the country, and a woman's right to bodily autonomy is under attack. Even our own medical professionals, doing the best they can to provide the proper care that they're ethically required to, are under attack. You know, I truly believe that each one of us sitting in these seats makes decisions in our roles as elected officials because we believe we're doing what's best for our constituents and what's best for health and safety in the state of New Hampshire. Today, I'm asking you, my colleagues, to consider the very real implications of the decision made last year. Right now, 12,000 low-income Granite Staters have had their preventive health care access jeopardized. New Hampshire has told doctors they now could be criminalized for doing their jobs, and more restrictive abortion bans are coming down the pipeline, potentially from the House. This language had no place in the budget, and it really has no place in New Hampshire. We're a state that deeply respects privacy, and we pride ourselves on some important statistics, like the lowest teen pregnancy rates and unintended pregnancies in the country, and strong fetal and maternal health outcomes. I urge this committee to support Senate Bill 399 and in turn support New Hampshire families facing these difficult circumstances, and support our health care networks. They're there to provide safety for all New Hampshire residents. With that, I'd conclude my testimony. I'd be glad to answer any questions.
Thank you very much, Senator. Are there questions? Senator Whitley?
Thank you, Madam Chair. Thank you, Senator, for your testimony. So you talked a lot about access to care. That passage of this law put access in jeopardy. And I'm wondering if you think, the repeal of this is necessary to, it's likely that women, if they can't get care in New Hampshire, they can go to Massachusetts, but that's not everyone, correct? So I'm wondering, who is this really jeopardizing access for?
Thank you for the question, Senator. I think it's jeopardizing access for a number of women, particularly low-income women. It's jeopardizing access to other services for many of them, which include access to birth control, access to cancer screenings, and other services, because we've jeopardized the ability of these entities to provide the care that they're accustomed to, and to many of our healthcare professionals. Thank you.
Are there any further questions? Seeing none, thank you very much, Senator. Next, we're going to call Senator Tom Sherman, and after that, Senator Prentiss. Senator, we're doing the 3-minute rule. Let me know when you're ready.
Okay. Thank you. I'm ready. Thank you, Madam Chair, members of the committee. For the record, my name is Senator Tom Sherman, District 24, 11 towns over by the seacoast. I rise in support of SB 399, which is to repeal that portion of statute signed into law by Governor Sununu as part of the budget, instituting one of the most restrictive abortion bans in the country. My focus today will be on the impact on the medical community, and I rise to speak that way because I'm also a physician. I'm a doctor in Exeter. Repeal is needed for the following reasons. Number one is the statute currently criminalizes the clinically appropriate care of patients. Number two, it undermines the viability of the OBGYN services, especially our top-rated maternal fetal medicine program at Dartmouth-Hitchcock, by really putting them at risk of criminal prosecution, even though they are practicing what is clinically acceptable medicine, and actually clinically essential medicine. It forces women to undergo often unnecessary, expensive, and invasive ultrasounds. It lacks the needed exceptions for the health of the mother and even for the health of fetuses in the 3rd trimester. And finally, it violates longstanding prohibitions against legislating clinical care. Let me be clear, this is the legislature telling women who want to seek an abortion that they must have an ultrasound. And that ultrasound includes, contrary to the expressions by some people throughout the state, that ultrasound may include an invasive, internal ultrasound. It fundamentally represents an unprecedented invasion into the doctor-patient relationship, stripping New Hampshire women's rights to make their own health care decisions. Thank you, Madam Chair.
Thank you very much, Senator. Are there any questions from the committee? Senator Khan?
Thank you, Madam Chair. Thank you, Senator, for testifying today. As a member of the medical community, we've received, I'm going to ask you to react to some of the letters that we've received from practitioners in the field, OBGYNs, nurse practitioners who have licensed to perform abortion services, who have done so for 30, 40 years, but are fearful that the climate in the state is not going to be conducive to either retaining our medical services or retaining the graduates of the Dartmouth-Hitchcock program that you referred to. So I wonder, as a member of that medical services profession, have you gotten that same feedback and input from the medical community about their apprehensions of being able to maintain quality OBGYN services in the state of New Hampshire?
Thank you for the question. I have, for sure. I've had lots of people reach out to me concerned about the impact of this on the clinical practice of medicine in the state of New Hampshire, especially in the field of OB. You know that we have challenges even in your district attracting physicians. We've lost many of our OB services, especially up in the North Country. And we currently have, in this very particular specialization, at least the #2 program in the entire country in maternal fetal health. We are used to working under the threat of a patient bringing a malpractice suit or something like that. We are not used to doing the very best we can, following our clinical guidelines, working to save the life of a mother or a fetus, and then facing a felony charge for someone's misinterpretation of what I did or why I did it. just because we've crossed that 24-week margin. That's the difference with this one. You know, I know physicians when I practiced in Virginia who were diverting opioids and ended up in jail for that. That's a crime. But can you imagine doing everything you can to make sure that your patient, the woman or the fetus, is as safe as possible, and determining with the help of the mother that you had to do a therapeutic termination of that pregnancy, and now you're facing, even if you meet maybe the letter of the law, you are still facing the possibility of criminal prosecution at a felony level. That's a completely different ballgame. And it's not what you're going to face in our neighboring states. And they're happy to take our highly trained, highly skilled OBGYN practitioners from us.
Thank you.
Are there further questions from the committee? Senator French.
Thank you, Madam Chair, and thank you, Senator. Could you explain to me how 24 weeks is one of the most restrictive laws in the country for abortions?
I'm not sure I understand your question.
So you said this law, as we passed it, was one of the most restrictive abortion bills passed in the country?
Oh, I'm not saying the 24-week mark makes it the most restrictive. It's the ultrasound requirement, it's the criminalization, it's the lack of protection in the face of rape or incest. It's the package that was voted in by the majority and signed by Governor Sununu that makes this one of the most restrictive in the country.
Got you.
Follow-up?
Thank you. So would you be in agreement with the 24 weeks?
No, because fundamentally what you're saying is that you, the legislature, or we, the legislature, knows better than a woman and her doctor. And if there's one thing that New Hampshire people will defend is stay out of my exam room. That's the fundamental. That's, you know, as you fight for this on many other levels. We all fight for this. Don't invade my bedroom. Don't invade my exam room. This is the fundamental privacy that we have in New Hampshire. So my firm belief is that this is an individual decision between a woman and her provider, and the state has no role to play in it.
Thank you.
Thank you.
Senator Gannon.
I know you're the son of a good drafting attorney on patent law, so I know you're into small details that I sometimes am into. Again, the Roe finding said the state had a compelling interest at 24 weeks. So at some point, especially they looked at, when I was listening to the testimony a few minutes ago, they seemed to find when it could function viably on its own with medical care, that the state had an interest, that was a life that we have an interest in protecting. Are you in disagreement, or am I misunderstanding Roe?
Senator, you have an interpretation of Roe. What has happened with the current statute has nothing to do with Roe. It's gone well beyond Roe. And so it doesn't really matter my interpretation or your interpretation. What I'm trying to do is protect a woman's right to make her own medical decisions, which has not happened in this statute.
Quick follow-up, and again, we've talked about this other times. Again, so at what point would you say an unborn child, you're a medical doctor, when is it a life that we're going to respect? Is it 26 weeks, 30 weeks, 35 weeks? Is there a point, or do you wait till the natural birth?
I believe that that is a clinical medical decision of, you know, every single child is different, and you know this. I mean, even though you're a lawyer, you go to doctors, and I'm sure you have children, you've been through this. Each of these decisions are made with the patient and their doctor. What is going to be the outcome? How are they going to do? And I know the chair has had personal experience with this. That is a very, very important individual decision, and it's not my place to make that decision. It's clinical, it's biological, and it's not up to me.
Thank you.
Thank you. Senator Whitley.
Thank you, Madam Chair. Thank you, Senator, for your testimony and for taking my question. So, as you may know, Roe was decided in the 70s, actually before I was born. And as a physician, I'm sure you're aware that what we know about pregnancy has changed a lot since the 70s. For example, my sister was born in 78. Ultrasounds were considered experimental. I was born in 1980. They were a matter of course. So what we know about medicine has changed about fertility. So as you know, Roe created the viability framework. But would you be surprised that when we heard from medical professionals time and time and time again on HB 625, which that abortion ban was based on, what we heard was that they told us viability is different in every pregnancy. We cannot have a bright line because viability is different for every woman, every pregnancy. Can you speak to that?
I would, not only would I agree with that, but I would also say the more we learn about the process of being pregnant and understanding all the issues that are accompanying that, the science grows, the ability to make these determinations changes, and so I would absolutely agree with what you said. I was born before Roe, by the way.
Are there any further questions for Senator Sherman? Seeing none, thank you very much, Senator.
Thank you, Madam Chair.
The chair will call Senator Prentiss, and after that would be Representative Love.
Good afternoon and thank you, Madam Chair. And before I get started, I just want to point out that in like 1970, I saw a few heads kind of sort of nod. Well, in 1980, is that when you were born? Correct. Oh, still in high school. Okay. Every once in a while, we need those reminders. So thank you, Senator Whitley. Good afternoon. My name is Sue Prentiss. I'm the state senator for District 5, which hugs the Connecticut River Valley from Lyme all the way down to Claremont. And I am here to speak today in support of Senate Bill 399. I know we have a time limit, so I will do my best. And when I came here in New Hampshire in 1992, I came to work for Dartmouth Medical School on a rural health outreach project. I spent time working on building primary care safety nets and EMS system, emergency medical service system stability throughout the state. This is a project that was based at Dartmouth Medical School, and I worked extensively, again, in the North Country all the way down through Claremont and addressing the impacts of our lack of primary care providers was having on access to health care. And again, this is back in the 90s, while better preparing them to do their jobs and fill the gaps. Starting in the mid-2000s, hospitals in New Hampshire saw the closing of maternity birthing centers, mostly then in the northern part of New Hampshire. We call these maternity deserts. Teaming up with obstetrical care professionals from Dartmouth once again, I took up the mission of access to health care, at this time maternal fetal care. We worked with the development of a system of triage, training for EMS and emergency department staff to help them identify and manage maternal fetal emergencies as well as get them to definitive care. Cited early on was meeting the staffing demands of birthing centers, risk, and reimbursement. Our ability to attract new providers to New Hampshire had already been injured. Over the past 20 years, New Hampshire has lost 10 labor and delivery units. Most recently, the unit at DeVries Parkland Medical Center closed in 2020, leaving swaths of the state without a hospital unit that specializes in delivering babies. This is no longer a rural problem in New Hampshire. The criminalization of obstetrical care providers in HB 2 of 2021 last year will continue to impact staffing challenges. I'm so proud to have Dartmouth Hitchcock Medical Center in my district, a world-class multi-specialty tertiary care and academic medical center. DH has the only OB training program here in New Hampshire, and I've spoken with longtime obstetrical care provider, one in particular at DH, who assures me that criminalizing care given by OB providers is going to make it more difficult for them to recruit and retain OB providers, and especially the ones that they're training right here in New Hampshire. When prospective providers have choices, a state with criminal penalties for doctors is not an attractive one in which to practice. Consider specialty practices like neonatologists. They will face the same questions and concerns when investigating New Hampshire as a home for them to practice maternal fetal medicine. Is this the consequence that we want? Healthcare cannot pivot based on who sits in these seats. Rather, it must be grounded in the best practice, medical evidence, and not politics. care should be determined by providers who know the literature, adhere to best practices and standards, and are trained to provide the care. Banning abortions after 24 weeks with no $3.99.
Thank you very much for your testimony, Senator. Are there any further questions? Senator Khan.
Thank you. You've touched on an important question for me, and that's the healthcare deserts that exist in this practice of OBGYN. The Monadnock Hospital in Peterborough is one of those 10 closures.
Yeah.
And we've gotten testimony from some physicians saying that they've been diagnosing fatal fetal abnormalities at 21 weeks and after. Diagnosing. And I'm concerned with the amount of time that it might take for somebody first to absorb that kind of information and the complexities that go into that diagnosis. And then are we creating an irresponsible time frame for decision-making and evaluation in the best interests of both the mother and child?
I would say that we are, and we are in a position where we're creating distance, not just geographical distance, but the distance between the time of diagnosis and having access to, consultation and making decisions between, a family and their medical care provider about this particular situation.
Thank you, Senator.
Thank you very much. Are there any further questions? Seeing none, thank you very much.
Thank you very much.
Okay, the chair will call Representative David Love, and after Representative Love will be Representative Prudhomme. O'Brien.
Representative Love, followed by Representative Prudhomme. Representative Love got called over to the LOB for another hearing.
Okay. Is there a Representative Prudhomme O'Brien? Okay.
He is also not here.
Okay. Then we're going to go to Representative Kurt Wolper, and after Representative Wolper, we will be going to Representative Toll.
Representative Wolper.
Oh.
Also in committee, Madam Chair.
Okay, how about Representative Toll? And after Representative Toll, we'll have Representative Stapleton.
I'm sorry, I didn't catch that.
Okay, after Representative Toll, we'll go to Representative Stapleton.
Representative Cole, followed by Representative Stapleton.
Good afternoon. My name is Amanda Elizabeth Toll, and I represent the City of Keene at large in the New Hampshire House of Representatives. I am here today in support of SB 399FN, which would repeal New Hampshire's abortion ban and ultrasound mandate. I, along with the vast majority of my constituents, oppose New Hampshire's abortion ban and mandatory ultrasound requirement. New Hampshire's abortion ban and ultrasound requirement are an affront to Granite Staters who value freedom, gender justice, the sanctity of the patient-provider relationship, healthcare access, and our civil liberties. New Hampshire's residents are very supportive of reproductive freedom, some of the most supportive in the country. Polling shows that the abortion ban is deeply unpopular with Granite Staters. I also want to speak in support of this legislation, not just as a legislator, but as someone who's needed abortion care. My abortion let me live the life I wanted to live, to go to college and grad school, to open my own business, to have a child when I was ready, and to become a state representative who is advocating for public policy based in compassion and injustice. This played a role in my development into a reproductive justice activist, something I've been involved in for more than 20 years. Sharing my own abortion story for years, hearing the stories of others, I know one thing for sure. Abortion care is an intersectional issue. People of all economic classes, races, and religions access abortion care. Legal barriers to abortion will not stop abortions. They will only keep disenfranchised folks from accessing the care they need, sometimes with deadly results. As government officials, our goal should be to expand access to care, not to limit it. Abortion is health care, and health care should be a basic human right. I hope the Senate Judiciary Committee does the right thing and stands by providers and their patients and passes SB 399FN. Finally, given that there are many voices waiting to be heard today, I am submitting written testimony in favor of SB 436, the Access to Abortion Care Act. Thank you for hearing my testimony. I'm going to defer questions to the medical experts and reproductive rights organizations that are here today. Thank you very much.
Thank you, Representative. The chair will call Representative Walter Stapleton, and next after that will be Representative Erica Land.
Representative Leon, Representative Stapleton, Representative Leon.
Representative Stapleton.
Thank you, Madam Chair, and members of the Senate Judiciary Committee for letting me speak today on this critical issue. I'm Walter Stapleton from Claremont, New Hampshire, 3rd Ward Representative, Sullivan County, District 5. I am opposing SB 399FN, which seeks to repeal the Fetal Life Protection Act. Titled as the Reproductive Health Privacy Act, this bill would throw New Hampshire back to basically unrestricted abortions, essentially at any time, up to the point at or near birth, and then only prohibited by our current RSA 329:32 to 42, the Partial Birth Abortion Act. Both SCOTUS decisions in Roe v. Wade and Planned Parenthood versus Casey indicated that a woman does not possess an autonomous and exclusive right to privacy as an enabler to an open abortion anytime, because the state has a reasonable and compelling interest in protecting life in the womb, because this life are its future citizens and human beings. Even in our own statutes at 329:41, titled Construction, paragraph Roman 1 declares, nothing in this subdivision shall be construed as creating or recognizing a right to abortion. Polls show that approximately 65 to 75% of citizens oppose late-term abortions, and many of my constituents have repeatedly indicated their abhorrence for abortion at any time except in the case of medical emergency or risk to the life or the essential functional health of the mother. Some have asserted that the Fetal Life Protection Act fails to provide any exception for rape or incest. However, the bill provides 6 months for a woman to make such a decision for abortion, regardless of the reason. New Hampshire's Fetal Life Protection Act is a humane, reasonable, and proper statute for balanced protection of both the late-term viable baby and the liberty to choose abortion prior to the 24-week limit. And the ultrasound is not a prescription for a medical procedure, but rather a tool to recognize, effective tool to recognize a good tool for determination of that 24 weeks so that it's not crossed the line by the provider and therefore protects the provider as well. HB 399FN repeal of FLPA is a harmful and unreasonable initiative and should be opposed with your votes to declare it ITL inexpedient to legislate.
Thank you, Representative. Are there any questions for the representative? Senator Gannon.
Thank you, Representative. Just a quick question. Whereas this bill doesn't go after any early stage of development, doesn't go at 6 weeks with a heartbeat or anything like that, where it goes at 24 weeks, would you consider this a very modest attempt at regulating abortion?
Yes, Senator, I would. If you look at Dobbs versus Jackson Planned Parenthood Clinic at 15 weeks and the Texas abortion ban of 8 weeks and others somewhere in between, I think New Hampshire's law is modest and reasonable.
Thank you.
Are there any further questions for the representative? Senator Cont.
Thank you, Madam Chair. Thank you, Representative, for your testimony. I didn't listen in on HB 1609 testimony this week. I don't know if you did, but apparently the governor offered some testimony there. There are changes to the current act that are proposed, or at least were proposed to the committee. Did you agree with that those changes would help provide a better definition of the intent for the state to define the type of abortion care that should be provided in the state?
Thank you for your question, Senator. I attended that hearing 1609, but I got in there late, so I'm not privy to all of what happened before my arrival there. But the amendment which was offered clarifies for many people the misperception that 625 and HB2 required an ultrasound at every abortion. And I think that comes from reading the law out of context. You have to take the whole statute, the whole section. And if you go to the criminal penalty section at 329:46, it is clear that the focus is on 24 weeks. And the language could have been better in 329:44, but the amendment brings forth that language from the penalty section up into 329:44 so that it becomes clear to most people to understand that. And as far as prescribing a medical procedure, a specific ultrasound, there's nowhere in the statute, in the law, that does that. And it's been, unfortunately, an assumption that it might require an endovaginal or transvaginal as opposed to a transabdominal ultrasound. And I suppose that comes from, if you assume that you had to have an ultrasound for every abortion, early term abortion might have to look at that particular endovaginal procedure. But again, the law does not prescribe the type of ultrasound. It prescribes the use of it as a tool for determination to protect the mother and the provider and the fetus as well.
So if I might
Follow up?
So you were opposed to 1609 and any of the provisions in that bill?
I was opposed to 1609, but I understand in the executive session following the amendment was presented, which basically wiped out all of 1609 and instead put into place the clarifying text language on this particular issue of when ultrasound should be done as a tool for determination.
Thank you.
Senator Whitley.
Thank you, Madam Chair, and thank you, Representative, for taking my question. So I have been pregnant before. I have an 8-year-old, and I have had an early ultrasound. And early on in a pregnancy, when the fetus is so small, the case is that you cannot date the pregnancy early on with a transabdominal. It has to be a transvaginal. But my question to you is regarding the heartbreaking stories that we heard time and time again. We received testimony in this committee from women who received absolutely devastating news late in their pregnancy. Women who had pregnancies that were very, very much wanted, perhaps later in life, that had worked many years with fertility doctors to achieve pregnancies. We heard from those women that when they received that diagnosis, that perhaps the fetus would not survive post-birth. What would you say to a constituent who would be forced to carry a pregnancy against her will, knowing that that baby would not survive? What would you say to her?
Oh, thank you for your question, and it was a lot of emotional testimony there, and brought a tear or two to my eyes as well. We have 6 months to make determinations for abortion for any reason, which is most reasonable in comparison to what else is going on in the country. And while there is no exception for rape or incest, again, 6 months is a time to determine what you're going to do if that is a particular situation. There is exception for the life involved with the mother, and so you know, we have to rely on what we have in the law as an adequate protection for those circumstances, which are probably going to be the minority of situations in these cases.
Follow-up?
Follow-up?
So you indicated women have 6 months, but what we heard is that sometimes the diagnosis, the fatal fetal diagnosis, will come later in pregnancy. So you're going to force that woman, even though there's a fatal fetal diagnosis, they don't figure out till later in pregnancy, you're going to have to tell them that they're going to have to carry that pregnancy against their will?
The law allows 6 months to make a determination, and if there is special medical emergency situation following that, then my understanding is that there is an exception for that in the law, and that may, what you cite is perhaps a case of medical emergency, or maybe even life of the mother.
You're all set? Okay. Thank you very much, Representative. Are there any further questions?
Thank you.
Seeing none, thank you. The chair will call Representative Leon, and then after that, Representative Folsom.
Representative Leon, Representative Folsom.
Thank you.
Okay, we are on a 3-minute
Yes.
timer, so if you hear something go off.
Okay.
Kayla,
Thank
you're
you,
ready.
Madam Chair, and thank you, committee, for letting me come today. It's even scarier sitting in front of you in person than it was on Zoom. I just want to let you know that right off the bat. I'm here because, one, I'm the one who sponsored the original Fetal Life Protection Act, and I also am the one who sponsored the amendment that we passed yesterday on 1609 in the House Health and Human Services and Elderly Affairs Committee.
Representative, can I get you to identify yourself for the record?
I'm sorry.
That's
See,
all right.
I'm new.
That's all right.
I'm Representative Beth Folsom, and I represent Grafton 11, which is Wentworth, Dorchester, and Canaan.
Thank you. Please continue.
So what we did with the amendment is we solved the greatest issue that seemed to be wrong with the original bill, that people were stumbling over the whole issue of when the ultrasound has to be done and what kind of ultrasound had to be done. And so that was the amendment that seemed to be the largest argument that we had with regards to the act. And I will be glad to answer any questions about that. But I'm also here today as a woman because I want to speak to the whole issue of rape and incest, because that is something that's often thrown up. I am a victim. I was a victim. I'm no longer one of rape. And I'm here to tell you that when you are raped, for the most part, whether it's written protocol or not, you are offered at this point in time a pill. Most of us call the morning after pill. There's several different ones at the time that you are examined by a doctor. So that concept is brought up right away. The other thing is that when you have been raped, you watch the calendar. You look at every single day and you are counting down the days until your next menstrual cycle. You're not putting that decision off. It's fortunately for me, I ended up not having to face the decision of an abortion, but I had to face that every single day as I looked at that calendar and weighed it. I would not have waited 6 months. I know very few women that would wait 6 months. Most women, if they don't want you to know they've been raped, they're going to make sure that they've had an abortion before it shows. So that, I mean, you just need to understand that. The portion on incest, both of these are just terrible crimes against a woman, and I'm not going to pretend otherwise. With incest, it's often children. Is that my terrible sound?
Yes. If you could wrap it up.
Okay. With incest, if the victim is able to separate themselves from the aggressor, then usually that happens because someone else has intervened and they will help that person. If they are still under the control of that aggressor, that aggressor is going to make sure that that young girl or woman has an abortion before anyone finds out. So by 24 weeks, those hard, gut-wrenching decisions have been made, and we need to spend more time and energy discussing on how to help those women who have been sexually abused by incest or raped.
Thank you very much for your testimony, Representative. Are there any questions? Senator Whitley.
Thank you, Madam Chair, and thank you for taking my question and coming before the committee. So you're not arguing that every rape victim has the same experience as you, are you?
No, I'm not. I'm not. But I'm just telling you what, going through my experience and hearing from others is what I've heard.
Follow up?
Follow up?
And you're not arguing that every victim of rape or incest has the same access to care that you might have? Are you arguing that every victim of these horrible crimes would have the same access to care that you would? Is that what you're arguing?
Any victim of rape would have complete access to an abortion at any time up to the 24 weeks. They have full access.
Follow up?
Follow up?
Are you aware that during the pandemic, the past 2 years, there's been a dramatic rise in child sex abuse cases? Are you aware of that?
Yes.
Okay. And do you believe that every single child, unfortunately, has the same access to a trusted individual or a trusted person that they can go to? Are you saying that every single child has that access?
No, I'm not. I'm not saying that every child has a trusted person, but what I am saying is quite often that aggressor is going to make sure that if they find out that the girl is pregnant, they're going to make sure she has an abortion before anyone else finds out.
You don't know that?
I don't know that. I just from anecdotal stories given to me. That's.
Okay. Any further questions? Okay. Seeing none, thank you very much, Representative.
Thank you.
Okay. Next, we're going to call Jason Hennessey, and after that, Matt Hood. Jason Hennessey. Please come forward, Mr. Hennessey. We have everyone on a 3-minute timer, so that way we can ensure that everyone has an opportunity to testify. So let me know when you're ready. And please identify yourself for the record.
Sure. I'm ready.
Okay.
Honorable members of the Senate Judiciary Committee, thank you for hearing me out. My name is Jason Hennessey. I am the president of New Hampshire Right to Life, New Hampshire's largest organization that focuses on life, and on just life. I'm also a scientist with a PhD in computational sciences and statistics, as well as a resident of Amherst, New Hampshire. And I'm here to convey that Our organization, which represents thousands of New Hampshire pro-life citizens, is vehemently opposed to SB 399. So I'd like to ask everyone listening to consider two questions. First one is, who is a person? And should that definition depend on one person's choice? And then the second question is, what protections do they deserve? Some of the greatest oppressions of human rights in history have hinged on these questions. So if this bill was just about personal medical decisions, I wouldn't be up here testifying against it. But medical science says that there is a second person here. The Fetal Life Protection Act protects only babies that are at 24 weeks, which is generally considered when a baby can survive outside the womb. This bill would move New Hampshire backwards to have one of the most hostile views in the country against babies, allowing them to be killed even up to the hour before they're born for any reason. The Guttmacher Institute, which is a pro-choice research group, says that there are 43 other states that have some restrictions on late-term abortions. And many of them, if you look, do not have some of the exceptions that people are complaining about. A poll as recently as 2019 showed that about 80% of Americans agree that late-term abortion should not be allowed. So the FLPA reflects a broad consensus across America that these unborn babies are considered persons who deserve protection. So if the law is there to defend the defenseless from harm, who is more defenseless than someone who can't run, hit back, or even scream? One thing that I would like to convey is that actually there's substantial evidence that delivery or C-section is actually much safer for the mother, both at 24 weeks and it actually just gets in late-term abortion actually gets even more risky the farther out you go. So allowing it for any and every reason is actually harmful to maternal health outcomes. So with that, I would be open to any questions.
Okay. Thank you very much for your testimony. Are there any questions? Senator Gannon?
Just want to pick up on a little what you said. I'm probably in agreement with you on a lot of it. Policy to me is legislative, is that correct? And is that why you're seeing that one person shouldn't be able to decide when life begins? Because we'd have 500 different people doing different things in the state, so we have to put in bumpers like in a bowling alley for a little kid to give them some guidelines, do we not? So is this, I feel it's the correct place to be, that the legislature makes a policy decision. Is this the correct place? Dr. Sherman didn't think it was. Other people don't think it is.
Yeah, so Senator Gannon, I would totally agree with you. If the humanity of a person is up to one person's whim, who might have gotten up on the wrong side of the bed that morning, anything can happen. And so as a society, we need to come to an agreement of who are people and what protections do they deserve.
Thank you.
Are there any further questions? Seeing none, thank you very much for your testimony.
Thank you, Senator.
Okay, next we're going to call Matt Hood, and with him he has Dr. Ilana Cass. After that, we will be calling Devin Quinn. Come forward. We are on 3 minutes, so good to see you again.
Nice to see you as well. For the record, my name is Matthew Hood. I'm Vice President of Government Relations at Dartmouth-Hitchcock. As this committee will be familiar, Dartmouth-Hitchcock opposed the Fetal Protection Act last session for several reasons, including the ultrasound requirement, the lack of exceptions for rape, incest, and fatal fetal anomalies, and the imposition of criminal penalties on providers. For these reasons, we're here to support the repeal. With me today is Dr. Ilana Cass. She's the chair of the OBGYN department at Dartmouth-Hitchcock, and she will speak to these concerns in more detail. Thank you, Madam Chair.
Thank you very much.
Madam Chair and members of the committee, my name is Dr. Ilana Cass, and as Mr. Hood has explained, I'm the chair of the OBGYN department at Hitchcock Medical Center, the only obstetrics and gynecology training program in the Granite State. And I'm here today as the voice for the women of New Hampshire and their obstetrics care providers. I know you are here today motivated by the desire to better serve your constituency. This legislation does not achieve that noble goal. Rather, it imperils lives and equal access to excellent health care that the women and families of New Hampshire deserve. A woman and her partner seek a termination late in pregnancy under great duress and for truly dire circumstances. When a pregnancy threatens the mental or physical health of a woman, or the fetus has significant congenital lethal anomalies, a woman and her partner turn to the expertise of highly trained obstetricians and neonatologists. These women's stories are truly heart-wrenching as they face this agonizing decision about how to proceed. As of January 1st, 2022, many of these women will be turned away from the care that we are fully capable of providing here in New Hampshire. They will be forced to travel great distances away from the support of their communities and their families, incur additional expense, thereby compounding the inequity of care for our most marginalized women. Moreover, we have incontrovertible data that shows that women who sought a late termination of pregnancy and were turned away were at significantly higher risk for economic hardship, poorer health for themselves and their existing children. These women who were effectively turned away from a later termination were more likely to remain in abusive relationships with partners, had higher dropout rates from school and college, and had higher risks of serious complications, including death, as a result of that pregnancy. Today, the law of the land in New Hampshire does not recognize that severe and lethal congenital anomalies, incest, or rape are indications for a woman to seek a termination of pregnancy later on in her pregnancy. This legislation, moreover, demands unnecessary and costly testing and sends a doctor to jail for providing this procedure. The law of the land effectively substitutes medical judgment and authority of legislators for that of highly trained obstetricians and neonatologists. In future, this legislation will steadily erode access to these high-quality health care for the women and families of New Hampshire by deterring the brightest and most qualified obstetricians and neonatal providers from practicing in our great state. As a person with responsibility for the most of the pregnancies in the state of New Hampshire and obstetrical providers, I implore you to strike down this legislation. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Senator Whitley.
Thank you, Madam Chair, and thank you both for your testimony. I appreciate you taking time out of your practice to come speak with us today. We understand that it is a difficult time to be a medical provider in the state of New Hampshire, and so we're grateful for that. So it's been suggested in New Hampshire that this is necessary. This law that was passed last year is necessary because women just wake up one day and decide, I think I'm going to have an abortion today. You know, maybe it's been suggested they woke up, you know, on the wrong side of the bed. Is it your experience that women take the decision to terminate a pregnancy, to have an abortion? Do they take that lightly? Do they just wake up one day, a day before they're about to deliver? Is that a reality in New Hampshire?
Absolutely not, Senator. And I will limit myself to the circumstances of termination of late in pregnancy, although I'm certainly happy to expound upon earlier gestational ages. But again, I would remind you, these are circumstances. Why would a woman seek a termination of pregnancy at this late gestational age? Again, speaking to use your own terms, hasn't she figured that out already, and why has she delayed? In some scenarios, the pregnancy itself, as it progresses, threatens the woman's life. So she now has to make that agonizing decision. She may, in fact, die as a result of carrying the pregnancy. In some cases, the patient has been noted to have, over the course of her ultrasounds, a lethal congenital anomaly that was simply not recognized, either by virtue of access to care, again with COVID and all of the limitations that we currently have. In some cases, our patients literally don't get to us in time. In some cases, these conditions aren't definitively even diagnosed until later on in pregnancy, well after 24 weeks. And in some cases, that specifically of rape or incest, the patient is facing progressive psychological trauma. And again, in the scenario I've described, if she is living with or in somehow contact with an abusive partner, she literally can't get away to get the care she needs. So I would absolutely paint the picture that this is not a decision taken lightly. These are women who are in absolute distress, and these are circumstances that are incredibly heart-wrenching, and we want to be able to provide care for these women.
Are there any further questions? Senator Gannon.
Thanks for being a medical provider. We appreciate it. Just two questions. One is, this year at the beginning of your testimony, you said many will be turned away. I don't recall if it was you or other colleagues from Dartmouth last year who said there's very few late-term abortions, very few, very rare are fetal-fatal anomalies detected after 24 weeks. So when we're saying many will be turned away and very few, I'm just wondering what type of quantitative number are we talking about in the state, or do you know?
So certainly, with respect to quantifying the number of individuals who seek termination of pregnancy after 24 weeks, it would appear that this is a small number. Now, that's prior to COVID, and we have certainly seen an increasing problem with access to care. But yes, I would project it is not very many women at all who seek those services. The many that I've referred to is that of those women who seek a termination of pregnancy after 24 weeks, we will simply now, according to the law of the land, be unable to care for these women.
Just a quick side question. Has this affected, the law has only been in effect for a few weeks. You were aware of it, though, for many months. Has it affected applications to your pool to be in obstetrics at Dartmouth? Are people turning you away? Have you heard that?
So I would say to you, I think the issue about the specific legislation turning women away at 24 weeks gestational age, we have not had a patient who has required that service thus far.
I'm sorry, I meant your enrollment, your application.
Yes.
Okay.
I would say to you, it has affected the specific provision of criminalizing providers who perform this procedure. That is a fairly significant deterrent to seek practice of obstetrics in the state of New Hampshire. And in addition, as I'd indicated, the mandate for ultrasounds as part of any termination procedure is a deterrent from what we've heard from applicants to our program, because that really does cross the line in which, as I've indicated, now the medical authority and training for that we possess as medical providers is really being cast aside in favor of legislators deciding what is the appropriate care.
Thank you.
Are there any further questions? Senator Khan.
Thank you, Madam Chair. And thank you for being here today. I think you have a unique position in our state, truly unique, as being the chair of the only OBGYN program in the state of New Hampshire. So there are a couple of questions that I would like to ask of you. First off, how many students will graduate from the medical school at Dartmouth with the specialization OBGYN this year?
Thank you for asking. We have approximately 90 graduates in the Geisel class, each medical school class every year. In general, about 10% to 15% of those individuals have pursued obstetrics and gynecology. So we are very fortunate that we have a wonderful medical school from which we are able to attract a fairly significant proportion who are interested in pursuing obstetrics and gynecology.
So if I could follow on that question, Madam Chair, that would mean about 9
Correct.
Seeking specialties
Correct.
in OBGYN. And how many of those will seek a residency? I mean, I assume that at this point in time, they're pretty anxious about their residencies.
They are. Those decisions will be coming out shortly.
And do you have insight into how many of those 9 are seeking those residencies in New Hampshire?
So the way the process works basically is it's a little bit of probability, but I can say that without question, more than half of them will apply to our residency program at Dartmouth-Hitchcock, and they will interview with us and we will be on their list.
Yeah.
Historically, it has been about half.
And continue. So
Yes,
if there are 4 or 5, that means currently you've probably got that number in residency. They need to make decisions about where they're going to practice beyond that residency. So if of those 4 or 5 that there are that might likely help fill the ranks here in New Hampshire, a shrinking pool, if we have heard previously, are we going to be able to attract any of these 4 or 5 to continue to practice in New Hampshire?
That's an excellent question, and I would say the stance on both family planning, providing abortions certainly is relevant in the selection of those 4 or 5 people who have a choice, but I would actually invite you to consider it's a very relevant decision for those 90 students who choose to come to Dartmouth for their medical school training. Because already in medical school, I will remind you, Senator, they are exposed to the full range of obstetrics and gynecology practice by virtue of our ability to provide those services at Dartmouth-Hitchcock. So this is actually influencing the careers, training, and exposure of a full 90 talented individuals who come to medical. So the impact, again, of criminalizing the provision of medical care to a patient in need, the provision, the mandate that certain diagnostic tests are determined by legislation as opposed to best data and clinical practice, that actually has an impact on all of the medical community, including our medical students. So it's much more far-reaching than just our residents.
So, may I?
Follow up?
So I think I hear you saying this is poisoning the well.
Correct.
If I could ask a different question?
Yes.
We've heard that we're in a rural state, fatal fetal abnormalities are diagnosed late or in a second trimester, maybe later. Hospitals that'll birth kids in this state. How long does it take to get a first appointment at Dartmouth for a specialty? You know, my family member might have a diagnosis at 21 weeks. They ask the doctor, where can I get in to have an appointment? What's the likely wait time?
So
to go to Dartmouth, where
right.
I might get a specialty doctor to examine me.
Right. So we try to accommodate certain circumstances like the one that you've laid out, Senator, as quickly as possible within a week. But I'd like to pick up the theme very briefly that you touched on, apropos deserts of care in the state of New Hampshire. And I would remind this august committee that in the past 10 years, we have seen the closure of more and more obstetrics units in hospitals, thereby making access to obstetrical care, that baseline first layer of obstetrical care in this state, increasingly rare and difficult. So we really do have entire swaths of the state, both in populous areas and even in less populous areas, where it's already impossible, very difficult, to get access to a healthcare provider. If you then put some of those providers in jail or start to limit the way that they practice medicine, I fear we set in motion a condition, a state in which we will actually be able to have fewer and fewer OBGYN doctors practicing in this state, thereby further limiting the access and compounding the problem that we simply don't have enough doctors, and women have to drive further and further and will incur more significant complications for their obstetrics and gynecologic care as a result of that access.
Last question, Madam Chair.
Yes, last question.
And so further and further distance to get care. Where would I advise, where would you advise a person at 24 weeks to get further care?
At this point, given that this is the law of the land, we can speak to providers in Massachusetts and Vermont, and there are select other places in the union where that patient could be cared for, but those are our available options as of today.
Thank you. And thank you for taking the time and
It's a pleasure.
offering your
Thank
expert
you.
testimony. Thank you.
Can I have a 10-second question?
Yes.
Okay, thank you, Doctor. I'll be really quick. Senator Khan was leading, not in a bad way, but he was leading you down to say that we're going to lose doctors in New Hampshire. That was the path he was bringing you down. But it isn't like these 9 per year who choose OBGYN. They're from all over the country. You're a world-class college. Those 9, I would be surprised if more than 1 or 2 are from New Hampshire. So really, we're picking up 2 or 3 from all over the country who are staying here and happy here. So it sounds like we're not keeping many, but we're really, out of those 9, again, would you say 1 or 2 are from New Hampshire, the other 7? So if we're keeping 5, we have a great pickup. People are wanting to live and stay in New Hampshire.
Right, so the math does get complicated as people don't always, the most common choice of where you will go into practice is actually the state in which you did your training. So that is the largest predictor of where you will go into practice, not actually where you were born or raised.
Okay, thank you.
So it does have implications.
Are there any further questions? I have a question, and I find that your testimony about people not wanting to stay here because of this restrictive new law is I think, very interesting. Because in doing a lot of reading, I've read that lower birth rates have had a big impact on whether or not an individual goes into the OBGYN field. That plus also outrageous malpractice insurance that physicians, especially OBGYNs, have to pay. Those are really very important determining factors in whether or not someone actually goes and pursues a career as an OBGYN doctor. So I'm just wondering, have you read those same types of things as well?
So I would say I think I probably have rose-colored glasses because I'm dealing with a lot of our, obviously the trainees who've already chosen to go into obstetrics and gynecology. And I think that in chatting with each of the candidates who chooses to pursue OBGYN when they're medical students, not a single one ever brings up the issue of malpractice. Not a single one ever brings up the issue of decreasing birth rate. I think we're very fortunate at Dartmouth-Hitchcock and amongst the partner groups that we work with all across the state, that we are able to offer a wonderful experience and exposure to the medical students, and they are undeterred. I think the birth rate has very little to do with their choice, and again, the fear of litigation has not been a major factor when we've spoken to the medical students. So in that regard, I don't think that those are major drivers. I will say that in looking at some of the states around the union, for example, Texas, it is very much the case right now that Texas is having trouble recruiting OBGYN faculty to work in that state by virtue of the incredibly restrictive legislation there. And I do fear that if we continue on this path, unfortunately, we may find ourselves in a similar circumstance that it would be difficult to recruit people who want to pursue obstetrics and gynecology to continue to practice in the state of New Hampshire.
Thank you for that answer. One other question that I have is that are you in contact with your colleagues around the country?
Yes.
Thank you for answering that. Is California having an issue in recruiting physicians?
No, California, to my knowledge, is not having a huge issue in recruiting. The weather manages to be the biggest enticement there. Yep, having practiced there for 21 years, they do have that advantage.
Well, we have the beautiful White Mountains here and the lakes, so we've got a lot of wonderful things to offer as well.
Indeed we do, Madam Senator, which is why I'm here.
The reason I asked is because you have talked about the criminalization aspect of this bill. California also has criminalization provisions in their abortion bill as well that they're almost identical. So I would imagine if New Hampshire is having this horrible experience, that other places that have criminalized doctors who do this illegally would be experiencing the same thing. Have you heard anything from those states as well?
Not from the state of California in that regard, but definitely in regards to Texas and the trouble that they're having recruiting faculty.
Okay, thank you. Are there any further questions? Seeing none, thank you both very much for coming forward today.
Thank you, Madam Chair.
Next, we're going to call Devin Quinn, and then we are going to call Representative David Love. So we're doing 3 minutes.
Yes.
Okay. Let me know when you're ready, and please identify yourself for the record.
All set, ready. Hello, I'm Devin Quinn, Director of Policy at the New Hampshire Women's Foundation. I'm here in support of SB 399. And in addition to the other testimony you'll hear opposed to the Fetal Health Protection Act, I'd also like to stress and point out the inequitable impacts of the 24-week abortion ban, particularly on low-income women, women of color, rural women, LGBTQ women, women who can become pregnant, people who can become pregnant, women with language barriers, survivors of sexual assault and domestic violence, and those with transportation means to seek care in another state. A 24-week abortion ban in New Hampshire targets women who need local, compassionate, reliable, and affordable care the most, because those who need this care will be forced to seek it elsewhere, and they may not have the means to do so in time. Further, the ultrasound mandate contributes to a culture of shaming women who need comprehensive health care by forcing them on a medically unnecessary and invasive procedure simply for accessing the care they choose. We believe that women and anyone who can become pregnant should be able to access affordable reproductive health care in their own state without experiencing shame or stigma. Lastly, we hope you'll consider the economic impact on women. Women who are denied an abortion, who seek and are denied an abortion, take 4 years on average to return full-time to the workforce after the birth of a child, whereas women with access to reproductive health care are more likely to invest in their schooling and job training and have higher rates of economic security. Women who have the resources to control their fertility have lower rates of poverty in their families, which disrupts cycles of poverty between multiple generations. When women are healthy and prosperous, our families succeed and our communities grow stronger. Thank you. I have written testimony as well.
Thank you very much for your testimony this afternoon. Are there any questions? Seeing none, thank you very much.
Thank you.
The chair will call Representative David Love, and then after that, we are going to call Frank Knack.
Thank you, Madam Chair. Thank you, committee members. For the record, my name is Representative David Love. I represent Rockingham 6, which is Derry. And for me, I think we need to start working towards making adoption the go-to thought when there's an unwanted pregnancy, rather than the barbarianism. And I really resent the fact that one of the senators here, I was listening to a live stream called pro-lifers barbarians. The fact of the matter is these babies are ripped limb for limb, okay? While they can feel pain, Dr. Ben Carson, has said that, you can bet they can feel pain. I've operated on them, okay? And to tear them limb for limb. And that's what this bill does. It brings us back to a point where there's no restrictions whatsoever on abortion, okay? Up till the minute of birth. And that, ladies and gentlemen, is complete barbarianism. And, it's up to us to stop that. We've got to put some limits on this. And, the fact, like I stated, a noted pediatric neurologist, neurosurgeon like Ben Carson, testified that, that the fact is they do feel pain. Yesterday I attended the House hearing on the Fetal Protection Act, and I sent a clip of the movie Unplanned around and I will do that here too, to the committee, and it shows the abortion doctor. It shows the woman that had worked for Planned Parenthood for years. She came out of the office and did a ultrasound assisted abortion. Okay, now those two actors were paid, but that little baby on that screen, wasn't paid anything. That baby the instrument went up inside the womb, and that baby was kicking, and kicking. He knew he was in trouble. He kicked at that instrument twice, and then it sucked him in. Okay, absolutely barbaric. And like I said, we've got to move on from this. Back in 1980, Roe v. Wade was challenged, and the late Sandra Day O'Connor, the Supreme Court's justice, said, no, I won't be able to get it verbatim, but it was more or less, we don't have any technology now, but as technology advances, we have to take another look at this. Okay, we have the technology now. We know what happens during an abortion, and it's got to stop. I don't think any one of us is a barbarian, and we've got to find a better way.
Thank you very much for your testimony, Representative. Are there any questions? Senator Whitley.
Thank you, Madam Chair. I just want to clarify that not one senator on this panel called anyone
No,
barbaric.
it was somebody testifying.
Yes, we would not say that. So I just wanted to clarify that. And also that it was you that called a medical procedure barbaric. So I just wanted to clarify that. Thank you.
Yes.
Okay, are there any further questions for the representative? Seeing none, thank you very much, Representative.
Thank you.
Next, we have Frank Knack, and after that, Kayla Montgomery. Let me know when you're ready, and we'll start the timer.
Madam Chair, members of the committee, thank you so much for the opportunity to testify today. My name is Frank Knack with the ACLU of New Hampshire, and we're here in strong support of SB 399. And I apologize if I repeat what's already been said. I was out in the hall, so I couldn't hear everything that has already been said. I'm going to focus just on two aspects of the current law that we have concerns with. I know others are covering other aspects, and that is the criminal and civil sanctions portions. Under this bill, because there's no clear universal definition of the point at which a pregnant person's life becomes endangered, even when a medical professional is almost certain that the pregnant person's life is in danger, they may hesitate because of the criminal and civil sanctions to provide the life-saving treatment that might be needed. And so that having those provisions in this law is deeply concerning. So we like that SB 399 is would strike that from the code. In addition, current law deputizes people unconnected with an abortion to sue a healthcare provider. There are specific provisions in current law that provide civil remedies for people, for a husband, the quote-unquote husband, if the person having an abortion, or their parent, to sue the healthcare provider for providing an abortion. And let me just give you a couple fact scenarios where that could play out. You could have an abusive husband who has legal standing to sue a healthcare provider if the pregnant person has an abortion. You could have estranged parents that they haven't been in touch with for who knows how long, have legal standing to sue a healthcare provider under current law. We think that's wrong. We like that we like the whole bill, but I just wanted to focus on those two aspects, and I know others will focus on the other good portions, the other reasons why these provisions need to be struck and this bill should be passed. So thank you very much.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much for your testimony. The chair.
Sorry, Jake Berry from New Futures asked if he was supposed to testify. He had to leave. May I hand his testimony in?
Okay, yes, please.
Sorry, thank you.
He was going to be.
I know he was next, yes.
He was next, okay. So next, we're going to call Kayla Montgomery, and then, and then we are going to call Ian Hewitt.
Good afternoon, honorable members of the Senate Judiciary Committee. My name is Kayla Montgomery. I'm the Vice President of Public Affairs for Planned Parenthood New Hampshire Action Fund and Planned Parenthood of Northern New England. I submitted written testimony. We support Senate Bill 399. You all have heard a lot from me over this last year on this abortion ban, so I will do my best to keep this very brief. I was going to talk about the impacts on the New Hampshire healthcare landscape, but I don't think that I could do anything different than Dr. Cass just did. So I will just say that it is very clear to me that we have some of the best doctors in the world right here in the state of New Hampshire. And they are clearly trained and experienced to take care of their patients in these really complex situations. But now, of course, we are sending these patients out of state when, again, we have the best doctors right here in New Hampshire. And that's, out of state if the patient can afford it, if they can get travel costs, childcare, hotel costs, all of that. So I just wanted to say that again. It's clear how incredible our doctors here in New Hampshire are. And I do want to touch on the ultrasound mandate, which of course is something that has been talked about a lot today and over the past year as well. So I think we're hearing a lot around the intent of this ultrasound provision, which might have been, the intent might have been regarding abortion later in pregnancy. But the reality is that under this new law, which of course has been in effect now for 19 days, the ultrasound requirement does apply to all abortions, regardless of when they occur during pregnancy. And as healthcare providers, Planned Parenthood of Northern New England is obligated to comply with state laws, regardless of whether or not they are supported by best medical practice. And failure to do so place our clinicians' ability to deliver care at risk. Sometimes an ultrasound is necessary for an abortion, but not always. Particularly early in pregnancy and particularly with medication abortion. Medication abortion is a safe and effective way to terminate a pregnancy prior to 11 weeks after the first date of your last period. If a patient knows the date of their last menstruation and has no risk factors, an ultrasound just likely isn't necessary. And while it is true that there is nothing in the current law that says an ultrasound must be transvaginal, at PP&E, most first trimester ultrasounds are performed with an abortion wand, which is inserted internally. So this new law has forced PP&E to change their healthcare protocols in all 3 states, as people in New Hampshire often travel to the closest healthcare center, even if it is in another state. The ultrasound requirement affects our ability to center patient autonomy, deliver trauma-informed care, and make sound medical decisions. Under this new law, ultrasounds are mandatory no matter the individual circumstance or the recommendation of the clinician. And this is an example of why politicians shouldn't be dictating personal medical care, because every situation is different. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you. The chair will call Ian Hewitt, and after Mr. Hewitt is Richard Johnson.
Good afternoon, Madam Chair and members of the committee. I have 2 points for your consideration today. Ian Hewitt on behalf of Cornerstone, speaking in opposition to Senate Bill 399. I've provided the committee with electronic copies of, and I've brought physical copies of, which I'll provide after my testimony, House Bill 1609, which was passed yesterday by the House HHS Committee. In its amended form, which Cornerstone supports, this amendment will reiterate and further clarify the very limited scope of the ultrasound requirement in the Fetal Life Protection Act. If any member of this committee has concerns that the ultrasound requirement in the current law is onerous, I think that's a misunderstanding, and I'd be happy to speak to that in questioning. But in any case, those should be more than addressed by 1609 as amended by House HHS. We would ask that Senate Bill 399 be ITL'd, but if the committee is not inclined to ITL 399, we would ask as a second best outcome that it retain 399, let House Bill 1609 work its way to this committee, and then consider House Bill 1609 at that time. Secondly, we think that some may in the coming days ask this committee to amend Senate Bill 399 to, rather than entirely repeal the current Fetal Life Protection Act, entirely remove the ultrasound requirement or add in an open-ended health exception. Either of those changes would make our current law entirely unenforceable, and we prefer the status quo ante to a merely symbolic law. We think that no law is better than a symbolic law for reasons of clarity and transparency, and ultimately better for life as well. So to be clear, we think Senate Bill 399 is an attack on human rights and human decency, and we hope it will be ITL'd. But should it be proposed and this committee consider entirely removing the ultrasound requirement or adding in an open-ended health exception, we and our supporters would ask as the second worst option that the committee OTP 399 in its current form. I'd be happy to take any questions about this bill, our current law, or related legal issues.
Thank you very much for your testimony. Are there questions from the committee? Mr. Hewitt, we've heard a lot of testimony about fetal anomalies that are detected in the latter trimester of the pregnancy. Does the legislation that was passed in the budget, does that address the issue of fetal anomalies?
It does not. It simply reiterates the narrow focus of the ultrasound requirement to cases where the provider has knowledge of a substantial risk that the fetus is 24 weeks gestational age or older. With your leave, Madam Chair, I could speak briefly to the fetal anomalies issue. I noted that during the hearing on 1609 yesterday, Representative Dr. Knack, who was not on my side, he was there testifying in favor of expanding abortion access. He was asked about a hypothetical similar to a situation this committee heard about last year, where a woman had an abortion because of lethal fetal anomalies at 35 weeks. The vice chair asked him about a situation like that, and Dr. Knack, again, not on our side of this issue, quite candidly said in that situation he would simply deliver the child and that would be perfectly safe and normal medical practice. I've spoken with Dr. Johnson, who's testifying after me, and I think he can corroborate that as well. Two more points on that. One, I haven't seen anyone on the other side deny that the vast majority of lethal fetal anomalies are detected significantly in advance of 24 weeks, which leaves us with a handful of exceptional cases on which we could potentially make law. The way to make law around those exceptional cases would be, instead of having a 24-week ban, to have a viability ban. For years, groups like ours tried to put forward viability bans in the House, which would, by the way, be more inclusive and protect more unborn children than our more modest 24-week ban. As Senator Gannon noted, you can be viable at 21 weeks. But anytime a viability ban was put forward, we strenuously heard from the other side that this would be very cruel because it would sneak up on doctors with criminal penalties. Viability varies from case to case. There's no clear standard. So the alternative is to set a line that takes account of most everyday experience, like 24 weeks, or to allow unlimited abortion up to birth for any reason, which, to their credit, I think many of the proponents of the current bill have said that that's what they support. And my last quick point is that before December of 2020, Massachusetts had a felony 24-week abortion ban, which had no exceptions for rape and incest because it was a 6-month abortion ban, and also had no severe fetal anomalies exception. They do now. In Massachusetts now, abortion's legal at any time and for any reason. But prior to December of 2020, and for many years, there was no fetal anomalies exception, and throughout that time, Massachusetts was consistently ranked as having the best or the second best medical care in the entire United States. Evidently, physicians were not deterred from practicing medicine there.
Thank you. And you brought up the next question I was going to ask concerning the criminal penalties. We've heard a lot of testimony about criminalization of physicians. Is this common across the country to put in criminal penalties for physicians that have these types of laws?
Well, there's a wide spectrum of laws on abortion around the United States. You heard from Dartmouth, of course, that Texas has a far more restrictive 15-week abortion ban, and there's a wide spectrum of penalties. Until just a couple of years ago, it was considered a moderate, middle-of-the-road solution to have a felony 24-week abortion ban. That was considered to be not on the extreme end of the spectrum, but in the middle of the road. Before 2019, Massachusetts, Nevada, and New York State all had felony 24-week abortion bans that imposed felony criminal penalties. Different in some ways from ours, but felony abortion bans, the same issue arises of potential criminal penalties. From 2019 to 2020, legislatures in all of those states effectively repealed those bans, and abortion is now allowed in all 3 of those states for any reason at any time. Massachusetts was the most recent. And on that topic, I should note, I think the legislation you have before you, 399, is nationally unique. In all of those states I just mentioned, Nevada, Massachusetts, New York, proponents of the bills to allow abortion up to birth sort of disguised what they were doing by only taking out the criminal penalties or creating open-ended exceptions. They did not nakedly authorize abortion up to birth for any reason and at any time. It seems to be only here in the live free or die state that, perhaps to their credit, abortion advocates have the honesty and the forthrightness to come before you and admit that they think abortion should be allowed for any reason whatsoever at any moment.
Okay, thank you very much. Are there any further questions? Seeing none, thank you very much for your testimony.
Thank you, Madam Chair.
The chair will hear from Richard Johnson and then Deb Bishop.
My name is Richard Johnson. I'm a physician. I live in Dunbarton, New Hampshire. Not that it matters, but I trained at Dartmouth. Speak highly of the place. I'm here to suggest that SB 399 is not good law. It's going to negate a law that just passed last year. And my three reasons are basically from a legal point of view, from a biological point of view, and sort of from a moral point of view. I'm going to deviate from what I'm going to pass out to you, but I want to say that it shouldn't surprise you that physicians disagree, not just about how a case should be done, but on moral and ethical issues. I think life begins at conception, and I don't make any excuses about that. That's biology. Human life begins at conception. The question before us is, where are we going to call this developing human a baby who is in need of and deserves state protection? The law that's on the books now, the Fetal Protection Act, says that it's at 24 weeks. That's what makes it a criminal event. Taking the life of someone that the state has recognized as a human, as a part of society that needs to be protected. As a surgeon, I've done hundreds and hundreds of cases, procedures, but they don't involve taking a life. That's the difference. Now, physicians disagree, and you and I know from history that if we say this black man is my property, or this Jew is a problem, or that this baby is the product of conception, we have now defined something so that we can treat them a certain way. It's a subtle thing. I have been twice with a woman who delivered her defective baby. She got, for a few hours or even less in one case, the opportunity to hold the baby, to use her name, and then to bury the baby. That is very different than dismantling the baby limb from limb, and we call that procedure an abortion. I'm going to give you my written thing, but I wanted to hit some of those highlights for you. As a physician, and I will tell you, I'm a past president of a national organization. One of our biggest issues is how do we protect OBGYN doctors who are being forced to learn how to do a procedure that they don't want to do? That's not the purview of this, but I want to tell you there's another side to the picture. And there are physicians who are pro-life physicians who would love to practice in New Hampshire. I'll be glad to take any questions.
Thank you very much for your testimony. Are there any questions? Seeing none, thank you very much. The chair will call Debra Bishop, and then after that, we will have Patrice Myers. Good afternoon.
Good afternoon. My name is Debra Bishop, and I've lived in Ware, New Hampshire for 36 years now. Thank you for hearing my testimony. I'm in opposition to Senate Bill 399. When I discovered I was pregnant at 22 and unmarried, I immediately set a date for an abortion at the recommendation of my doctor. The insurance at my job at the time would even cover all expenses. After a few days of wrestling with my decision, I decided to cancel the appointment and moved instead in the direction of adoption. My daughter was born in May of 1982, and she became the sheer joy of a couple who were unable to conceive. 3 years later, my husband and I discovered we were pregnant with a baby boy, and we were overjoyed. However, after some testing and an amniocentesis, it was determined that the possibility, and I quote, "the possibility of fetal anomalies is significant. Impending intrauterine fetal demise or severe intrauterine growth retardation are also possibilities. Another possibility is congenital nephrosis. Although some infants can survive for a short time, it appears that congenital nephrosis is invariably fatal. this fetus is at extremely high risk for having some other type of fetal abnormality or impending fetal demise if the pregnancy continues to viability, etc., etc. As you can imagine, we were devastated at this news, but rejected the recommendation of the doctor to end the life of our baby boy in the womb rather than choose life. Adam Wesley was born in June of 1985 and was whisked away from us immediately upon delivery to be inspected for any abnormalities. He was brought back to us a short time later and told, "You have a perfectly healthy baby boy." 20 years and 10 months later, during the Mother's Day floods here in New Hampshire in 2006, his life did come to an end when his car veered off the road and he was killed instantly while driving home from Liberty University, trying to make it home to surprise me on Mother's Day morning. Little did I know, 24 years before, that it would be the daughter that I had given up for adoption who would be the balm my broken heart needed while grieving the death of my second child. She had come to find us just 20 months before Adam's death. She calls me Mom, she phones me at least once a day, and it is as if we were never separated. I often think of the loss I would have faced if I had decided on abortion for either of these people. I would have missed out on 21 years of my son's life, and now to have both my daughters to help bear the burden of losing him has been healing. He filled my empty arms when I chose adoption. She has helped to mend my broken heart after his death. And we don't know what the futures hold for us, but we as mothers do hold the future of our children in our hands, and I'm asking you to help women make the best informed decisions for these people in their wombs by opposing this bill.
Thank you very much for your testimony. Are there any questions from the committee? And please accept our deepest sympathy on your loss.
Thank you.
Okay, next we're going to call Patrice Myers, and then after that, Laura L. Alzheim. Let me know when you're ready.
Good afternoon, Patrice Myers, Concord. I'm going to come at this from a legal standpoint. Every person in the world...
Yes. Yeah, we're having trouble.
I'm sorry. Every person in the world has a right to life, liberty, and the pursuit of happiness. This isn't given by man. This is given by our God. And it can't be taken away from us by man, not legally. It's in our Constitution. When an egg is fertilized, it grows and develops. That's the definition of life, growth, development. That means that that egg and sperm is now a person. These rights to life, liberty, and the pursuit of happiness aren't just for the United States. The United States just has documents to make it necessary for our government to protect them. That is the role, one of them, very limited role, according to our Constitution, of the government, to protect those rights. If this baby is a life, then you need to protect it. Those rights will extend to that baby while it's in its mother's womb. Because although it is connected to her, it is separate from her. I would suggest that you choose life. By the way, I am opposed to this bill. There is a law higher than the Constitution, and the God that wrote it doesn't depend upon your belief or disbelief to exist. He is. The truth isn't affected by your perception or by what you believe. It is. The truth is that we need to protect the lives of these babies because they can't protect themselves. And there's a lot in the higher law Bible, if you will, about shedding innocent blood. And there is no more innocent blood.
Sorry.
There is no more innocent blood than that of these babies. I will posit to you that that is physical life. There is another life, eternal life, and it's extended to everybody as well. The way to that is to accept Jesus Christ. And as I believe, if you don't accept that offer, you abort yourselves. So, I don't believe the government has the right to legislate taking the life of someone, no matter what stage of development that they're at.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you very much. The chair will call Laura L. Alzheim, and after that is Robert Lacoste.
Hello, ladies and gentlemen. Thank you for giving me some time today. My name is Laura El Azam, and I am from Londonderry. I'm here to ask that you oppose SB 399 and all efforts to weaken or repeal the Fetal Life Protection Act. I have 5 children, some of whom we adopted from the New Hampshire foster care system. Many of the kids who wind up in foster care have very, very difficult life stories. Some so tragic that they are even used to justify abortion as a remedy. I'm here to invite you to consider the foster care system as I do, as the canary in the coal mine, warning us of the perils of state-sanctioned violence. And abortion, most starkly late-term abortion, is exactly that. Raw, killing power inflicted on the very weakest and most vulnerable under the cover of law. When we accept the destruction of fully formed, live and kicking babies in the womb as legitimate, even for the greater good, it only follows that newborns and young children will also suffer. It is not the developmental age of the child, but the attitude of adults that makes a difference. There can be no justice in a society where every mother who holds her helpless newborn says in effect, "I love you. Yesterday, last week, I had the power to slaughter you, but I chose not to." This is tyranny. And it's an especially insidious variety because it attacks first and foremost the natural, essential bond between a parent and a child that is the very building block of a humane society. We are all, every one of us, affected. And so as a society, we have got to stop, rethink, uphold the dignity and worth of babies in the womb, or we can expect more cruelty inflicted on little daughters and sons. We will see more children disappearing, and we will witness more appalling images like last week's video of a New Mexico mother tossing her brand new baby boy in a dumpster to die. You have the power to defend the powerless before and after birth. Please preserve the Fetal Life Protection Act as written, or with the Folsom Amendment, if it should come your way. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you. The chair will call Robert Lacoste, and after Mr. Lacoste is Catherine Lacoste.
Good afternoon, Madam Chair, members of the committee. My name is Robert Lacoste. I'm from Stratham, New Hampshire. I was in healthcare for 38 years. 29 and a half years of that I was a practicing nurse anesthetist, advanced registered nurse practitioner. And I have some bullet points I'd like to start with. We're here today. I'm in opposition to this bill. The title of the bill is the Fetal Protection Act. We're talking about human life, children, unborn children. In my professional role, I've been retired for 7 years. In my professional role, I had a responsibility to counsel patients for various and sundry forms of anesthesia, the risk involved, the potential benefits. As far as therapeutic termination of a pregnancy within the scope of my understanding of the abortion industry. Over 95% of abortions are for birth control, not for fetal problems. I refer to you the name Bernard Nathanson. The gentleman, he's deceased now. He was a physician that performed over 10,000 abortions, and when ultrasound became available and he saw the results of the baby moving away from the probe to suck it out of the womb, he stopped doing abortions and became an anti-abortionist. Several people here testifying today have talked about recruiting physicians or loss of physicians within the rural areas of this country. One of my professional roles was Lieutenant Colonel in the United States Army. And as my professional role as a nurse anesthetist, along with my pay, which was based upon my time in service and my rank, I also had a recruitment stipend. And I would offer this panel, along with individual municipalities, if they're having a problem recruiting for their area, for any form of service, a stipend, an extra stipend, along with whatever professional pay they can earn. On a personal note, early in my career, I worked with an RN who was told after, I think, about 7 months, her baby, she was pregnant, a baby was deceased. She elected to carry that deceased fetus until term. I don't know how she did that, but she did that. On another personal note, my ex-wife had an abortion of my child, and I consented to it. And to this day, I regret that decision. It's very, very personal. I'm very sorry that I consented to her having the abortion. Any questions of the committee?
Thank you for your testimony. Are there any questions from the committee? Seeing none, thank you very much.
You're welcome. Thank you.
Thank you. The chair will call Catherine Lacoste, and after Ms. Lacoste is Carol Seeley.
Good afternoon.
Good afternoon.
Madam Chair and members of the committee. I would like to, Bob is my husband, and I would like to just give a little addendum to what he just said with his blessing. His former wife, Elaine, committed suicide, which we feel very strongly was related to her experience of having an abortion. And this occurred as we were welcoming our third child into the world. And I think I also have a career in healthcare that spans over 40 years. I've worked in just about every area, including anesthesia. The only thing I never did was pediatrics and psychiatric nursing, although when I was in critical care and emergency room, we saw plenty of psych situations. Healthcare has had many scientific advances, and the research has provided an opportunity for us to use an ultrasound. Why would we not want to do that? I can tell you one reason why is because many women, when they see their baby on an ultrasound, choose not to have an abortion. I've seen people at the best and the worst in their life. I've seen the devastation of poor choices, from addiction to depression and suicide, and I've seen also the true blessings of choosing life. Rape is a horrific act, and abortion doesn't fix the violation, but adds a further victimization to two people. Having an abortion does not undo the trauma of sexual assault, it just adds another trauma to one that already exists. The circumstances of conception don't determine your dignity. The humanity of a child is no different at 20 weeks than in late term. There's been much discussion about the relationship between a woman and her doctor. And I will refer to Hewitt Robinson, a former abortionist who had a conversion, and he said that this relationship is a red herring because there is no relationship between the abortionist and a woman beyond the ending of her baby's life. When Cain slew Abel, we all knew it was wrong. We can all attest to the sanctity of life as we sit here today as human beings. Don't all residents of New Hampshire have the right to live free? Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you very much. The chair will call Carol Seeley, and then after that, Peter Chamberlain. Okay, is Ms. Seeley here? Okay, you are Mr. Chamberlain?
Yes, ma'am.
And after Mr. Chamberlain, we will call Daniella Altscheis, I think it is, I'm not sure. Thank you. Please start.
Thank you, Madam Chair and committee, for hearing testimony today. I am Peter Chamberlain, and I'm the pastor of Granite State Baptist Church here in Concord, New Hampshire. I testify today in adamant opposition to the bill to repeal the fetal life protection law, along with any other attempts to move forward with the atrocity in New Hampshire of terminating the lives of unborn babies. There are several reasons for which I'm opposed to this repeal, but will only spend my time on a few. First of all, the most minor of the objections is the guidelines in which this has been brought before us. In the very bill, it says, and this is as a citizen, to put forth the repeal of this bill will reduce the financial burden upon the state is almost comical because the sponsors of this repeal are very rarely concerned about reducing the financial burden, but continually look to increase spending and taxes upon Granite Staters. The real purpose of this repeal should not be hidden behind a facade of fiscal responsibility and spending. That is all that was listed in that bill. Is actually, it's going to take a felony out of the books and therefore reduce the fiscal responsibility. Secondly, and primary objection is that as a pastor, it is time to say that the killing of unborn babies in the womb of their mother is wrong, unrighteous, against the Word of God, and a dark stain on the morality of our state and nation. The Bible reminds us in Genesis 1:27, so God created man. In his own image, in the image of God created he him. Male and female created he them. Again in Psalm 139, we're reminded that before any of the members of an unborn baby were even fashioned in the womb, that God has every member written down in his book. Every life is so precious in the sight of God that the God of heaven created them. All we hear about today is follow the science, follow the science. Well, if science were to be truly followed today, then you would acknowledge the beating heart within 21 days of conception. You would acknowledge the viability of a baby outside the womb due to the wonderful advances in our medical field. Every life is precious in the sight of God and should absolutely be precious in our sight. Now, as to the 24-week abortion ban that some want to repeal and get rid of, may I remind us that it was a 6-month-old baby, 24 weeks old, that first recognized who Jesus and his mother were while he was still in his mother's womb. The baby was none other than John. Luke chapter 1 informs us of that. John's mother Elizabeth was 6 months pregnant when the Virgin Mary became pregnant with our Savior, Jesus Christ. When Mary went to Elizabeth's house, who was 6 months pregnant, the scriptures record that John, the unborn baby, leaped for joy in Elizabeth's womb. It's undeniable that a baby of 6 months, and months before that, is a person and should be treated as such. We know and see our state motto, live free or die. Well, the unborn in our state are not being given that opportunity because they are not afforded the opportunity to live, but just being sentenced to death, and their only crime is their existence. It's time for this atrocity to end in New Hampshire and for us to value every life, which includes the born and the unborn. I ask every person on this committee, in the Senate, and in the corner office to not repeal this law, but to start being an example of value in life here in New Hampshire. Thank you so much for your time.
Thank you very much for your testimony. Is there any question from any of the committee members? Seeing none, thank you very much. Next, we will call Danielle Altscheis and then Valerie Prescott. Let me know when you're ready.
Sure. Thank you for the opportunity to speak today. My name is Dr. Daniella Altscheis. For 18 and a half years, I have had the pleasure of practicing OBGYN in New Hampshire. I was inspired to choose this career as practicing obstetrics is a privilege like no other. As obstetricians, we're present for the most joyous times in a woman's life, but also help a woman navigate some of the most physically and emotionally intense situations. The ultrasound requirement at any gestational age before termination of pregnancy and this 24-week abortion ban are cruel and unnecessary. This new law will have harmful intended and unintended consequences. I am here to support SB 399, which would fully repeal this law. First, to clarify, elective abortions at or after 24 weeks are not performed in this state. This ban does nothing to stop something that's not happening. The intended consequences of this ultrasound requirement and lack of appropriate exceptions to this 24-week abortion ban are as follows. No exception for a fatal diagnosis after 24 weeks. During routine prenatal care, an anatomic ultrasound of a fetus does not occur until 18 to 20 weeks. If an abnormal fetal finding is seen, that woman has to be scheduled with a specialty OBGYN called a maternal fetal medicine physician. By the time a fatal diagnosis is confirmed, a woman may be beyond 24 weeks. To see a woman and her loved ones hear their baby has a lethal abnormality is one of the hardest things to witness as a physician. No person in this room has the right to ask a woman to carry a fetus that has no chance of survival for months before spontaneous labor may occur or before that fetus is likely to die in utero. This is a form of cruel and unusual punishment to a mother already processing the future loss of her child. Number 2, an ultrasound requirement at any gestational age prior to termination. It's a provider's duty to determine how far into the pregnancy a woman is prior to termination, but an ultrasound is not always medically necessary. Early in the pregnancy, an ultrasound needs to be transvaginal, which is invasive and often painful. It can also be particularly traumatic for survivors of sexual violence. No person in this room should have the right to require a woman to have an invasive procedure that's not necessary. Number 3, criminal penalties for medical providers. As physicians, we respect our job to help our patients make appropriate healthcare decisions as we guide them with the facts and give them their options. No person in this room should be a barrier between the trusted and privileged relationship between a woman and her provider. I could never have imagined when I chose this profession I would have to worry about being charged with a felony. Last quick point is my concern about trying to recruit physicians to the area, given that OB units have closed in non-rural areas such as Lakes Region and Parkland, and that is one of the unintended consequences that I'm concerned about in this bill. Thank you for your time.
Thank you very much for your testimony. Are there any questions? Senator French and then Senator Khan.
Thank you, Madam Chair. And thank you for your testimony today. Could you tell me on fatal fetal anomalies, are they most detected prior to 24 weeks or after 24 weeks?
So because that anatomic ultrasound, as I spoke of, is not scheduled routinely until 18 to 20 weeks, although we have an opportunity through certain blood tests or early ultrasounds many fetal-fatal diagnoses are not seen of significance till that 18 to 20 weeks, and then it's that delay in confirming that for a woman where there are instances where it can be after 24 weeks.
So, follow up, thank you. So between 16 and 20 weeks?
18 to 20 weeks.
18 to
yeah,
20
routine,
weeks?
Routine prenatal care. Schedules ultrasound between 18 and 20 weeks. That's standard of care in obstetrics, and then seeing the specialist after that.
And then there's a, and then the procedure would be she would get a second opinion from a specialist who would confirm that there was a fatal anomaly, correct?
Correct.
And how fast would that happen?
So that's an excellent question, and certainly that question right now, there's oftentimes delay just with any COVID precautions, restrictions, but that could take a couple weeks before a woman is even in that office of the maternal fetal medicine specialist.
Okay. Thank you.
Thank you for your question.
Senator Cont, then Senator Gannon.
Thank you, Dr. Bushy. I appreciate your testimony and your profession. Where's your practice?
I'm with Bedford Commons OBGYN.
In Bedford?
Yes.
Okay.
We have offices other places, but deliver at Elliott Hospital.
Yeah. I think we need to hear from somebody to define an abnormality that might lead to this process that you just described to Senator French. Because, yeah, I mean, I don't think we've had that. And,
Sure.
And just give us, it'll be graphic, I suspect, but
yes.
I think we need to hear what is it that we're trying to have this debate as to whether 24 weeks is a sufficient time period in which to diagnose and treat a pregnancy appropriately.
And I will try to make that response succinct. I think a maternal fetal medicine doctor could certainly give a whole lecture on this, but the challenges that you speak of and that I'd like to educate everyone on is that, yes, there's blood tests that screen, which are elective. We offer all women blood testing that can screen for certain abnormalities. Not every woman or couple will choose to do that testing. That sometimes gives you some insight into some abnormalities. But that's not perfect. That is a screening test. And so we rely heavily on this anatomic ultrasound. So when I say this ultrasound at 18 to 20 weeks is happening, we call that ultrasound a fetal survey. The point of that 18 to 20 week ultrasound is to look for anatomy. It's an anatomic scan. That is truly the first glimpse we have at a fully formed fetus, to look at all the organ systems, from inside the brain to the hands, the feet, every organ system. That is truly in our field the first time we have a full, complete fetal survey. Although, and when ultrasounds are done earlier in the pregnancy, there are sometimes, and oftentimes, things that we see early on, but that routine prenatal ultrasound to look for anatomy is scheduled purposefully at 18 to 20 weeks when we can see the most, and be as confident as we can be to tell a woman, a couple, that to the best of our ability, this anatomy is normal, or we are finding things that are abnormal, even in a fatal or lethal way, if that helps.
Follow up?
Yeah, thank you. Brain development, spinal development, what's incomplete in the development of that child that you're going to pursue that might lead to this period of time from 20 weeks to potentially, I'm not putting the time limit on there.
Yeah, and that's a difficult question because there's things such as anencephaly, where a woman who had a very early ultrasound, where you only measuring what's called a crown rump length. You're just measuring from the top of the baby's head to the rump of the baby. Maybe another ultrasound doesn't happen till that 18 to 20 weeks. Anencephaly is a significant neural tube defects. There's times that you see significant issues of the kidney. There's times that you're putting chromosomal syndromes together at that 18 to 20 week ultrasounds. So there's many things that you would see at that time that a woman may not have had the opportunity to see, because we don't get many routine ultrasounds. Sometimes women have an ultrasound early in the first trimester, and another ultrasound is not until that 18 to 20 week ultrasound.
Thank you. If I have one different question.
One final question.
Given the state of the law that at 24 weeks, you've got a patient that comes up to that deadline, what are you going to advise them? Where shall they go for further service?
So the hard part is, as of January 1st, if a woman comes to us as OBGYNs in this state with a fetal fatal diagnosis after 24 weeks and is faced with that very difficult decision about what to do, should she choose to induce the labor or have a procedure, I have to send her out of state. I have a way to give her compassionate care here with her doctor who knows her and her family around her and within her insurance paradigm, and I have to send her outside the state. To that point, I think, this morning I saw patients before I came here, and I saw two patients that just stuck with me, one of whom had a few second trimester miscarriages. Another one had to be admitted in a prior pregnancy because her placenta was separating, and she was in the hospital prior to viability. And although those two scenarios may not pertain to this, it struck me that each pregnancy is unique and each circumstance is different. And we must ensure that women have access to the care they need when they need it, without laws restricting how doctors or any provider takes care of our patients. So, thank you.
Thank you.
Senator Gannon?
You already answered my real questions, but, so I remember for the 4 kids going in once in the first trimester, I think, right? And big wand on top, and you can see everything going on, the baby in there. And then, so that's the only time before, in a standard birthing, before the 18 to 20 week ultrasound, right? You just have one the first trimester probably, and then that one at 18 to 20.
Yes, typically every practice may organize things differently, but most times women have a first trimester ultrasound, whether for different clinical reasons, that's as early as 5 weeks, or into the 12th week. There's different reasons when you choose that first trimester ultrasound. But again, that 18 to 20 week is purposely scheduled for the anatomy.
Thank you.
Thank you.
Okay, are there any further questions? Okay, seeing none, thank you very much. Okay, the chair will call Valerie Prescott, and after that, Philip Tuttle. Let me know when you're all set.
Pardon me?
Just let me know when you're all set so I can start the timer.
All set. Can you hear me?
Yeah, we sure can.
Thank you for letting me speak. Thanks for letting me be here. Thank you for this country letting us do this. I'm a mother of 3 children, grown children. One of my children, when she was 21, came to me. Actually, I came to her because I was going to visit her. And as soon as I saw her, she came up to me with tears in her eyes. And she was so sad. And she said, "Mom, I had an abortion." She regretted that abortion. She was young, and she even knew that the baby was a little girl. If she didn't want to know that. She didn't have to know that, but she regretted that abortion. And then later we found out, I found out, she knew, but I found out she had been raped before that abortion and was impregnated because of that. So I just want you to know that even though young women are raped, it doesn't automatically mean they want an abortion. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you for your testimony. The chair will call Philip Tuttle. Okay, no Mr. Tuttle. The chair will call, I think it's Jim Mill. Let me know when you're ready to start, Mr. Mill.
Yes, I'm ready.
Okay, there we go.
My name is Jim Gill. I live in Hollis, and I speak in opposition to SB 399. A couple weeks ago, in the Dobbs case, Chief Justice John Roberts had described American abortion laws as extreme. Immediately, the fact-checking world started to say that that was in error, erroneous. He spoke mistakenly, untruthfully, and only recently have the fact checkers reversed their position, Washington Post being one of them, saying he was spot on. What he said was, there are only two other nations out of 203 or 5 or 7 on the globe that support abortion right up until birth. We're an illustrious or ignominious neighborhood, with China and North Korea being those only 2 other countries. 47 of the 50 European countries do not support abortion. The latest is not even up to 15 weeks. So I was outside listening to those who were in favor of repealing the Fetal Life Protection Act, and I'm thinking to myself, well, what makes them so smart that they're smarter than 500 million other Europeans with advanced degrees in leading medical facilities and universities to go on and on with how unreasonable it was to restrict abortions up to 24 weeks. And instead of tiptoeing around things and saying, well, what if the child, let's speak honestly here, let's get real, born with Down syndrome, cerebral palsy, ALS, you name it, rattle them all off. And I'm thinking to myself, I'm 67 years of age. I grew up in an era and a time when people had all kinds of children. Most of the families I grew up with in Lowell had a child with Down syndrome or something else. And I was surveying their families, and I'm thinking, here's that forbidden, we don't want to go there, we don't want to open the door. It's almost like buying a car. Shall we total the car because it doesn't have a transmission, doesn't have wipers, doesn't have a CD? It could be that when you buy it, it's, maybe we ought to total it. And I think of all these families, and I totaled up about 32 of them that I knew firsthand. They were the most loving families. The Down syndrome child kept those brothers together in the rough parts of the city and everything else. They looked out. So basically, if you support this legislation in relative terms, you're going against the developed world. If you support the legislation, you're voting for an abortionist grabbing a 9-month-old baby by the feet, pulling it down into the cervical area, taking scissors, puncturing the base of the skull, putting in the tube and sucking out its brains. That's what you're voting for if you support this. Thank you all for your time.
Thank you for your testimony. Are there any questions from the committee? Seeing none, thank you very much, Mr. Gill.
Okay, thank you.
Okay, next we're going to Jordan Applewhite. And then after Jordan, we're going to Josie Pinto. Let me know when you're all set.
Let's do
All
it.
right, we're going.
Hi, my name is Jordan Applewhite. I live in Sugar Hill. I'm coming to you all today to express my strong support for repealing the Fetal Health Protection Act. As someone who lives in the North Country, I'm very concerned about the increased barriers to access that my community now faces as a result of this legislation going into effect on January 1st. Up north, we do not have any places where people can access abortion care. The only options available to them are either driving to Concord or Vermont, each being at least an hour away, if not more. This leaves many people to seek out the services of crisis pregnancy centers, of which there are many up north. These places appear to offer care to patients, but are really manipulative facilities that work to convince patients to not go through with an abortion. Given that this is often the only place many people know to turn to, I can't imagine how many people seeking abortions have been forced to continue with their pregnancies against their will due to lack of access. The Fetal Health Protection Act only works to increase those barriers to access even more. Recently, I learned that there's a way patients can access abortion care from the comfort of their own home, utilizing telehealth medicine and getting abortion pills delivered to their door. I was so excited to spread the word about this option to my community, who I knew would benefit greatly from this increased form of abortion access. But right when I had started to do outreach about this, the ultrasound mandate went into effect, making this option impossible. We know that abortion bans disproportionately harm those who already face the greatest barriers to care, including people with lower incomes, people of color, women, LGBTQ people, people with disabilities, and people in rural communities like mine. My community already faces so many barriers when it comes to accessing any kind of specialized care, from the lack of internet coverage throughout the North Country to the lack of public transportation, and with the misleading and incorrect information perpetuated by crisis pregnancy centers and other groups looking to make abortion harder to access. It's hard enough to find doctors willing to work up north without this legislation further putting them at risk. Overturning this ultrasound mandate and abortion ban is just one small thing you all have the power to do in order to make rural access slightly better, which will in turn work to address poverty and other issues that can stem from having to continue an unwanted pregnancy. My community desperately needs more, not less, access to abortion care. Thanks for your time, and won't be taking any questions. Thank you.
Thank you very much. Okay, next we're going to Josie Pinto, and then Kelly Omu.
Okay.
Let me know when you're ready to go.
Cool. I'm ready.
Thank you.
Hello, my name is Josie Pinto. I'm an MPH student at the Dartmouth Institute for Health Policy and Clinical Practice, and I'm the founder and executive director of the Reproductive Freedom Fund of New Hampshire. We're an organization working to reduce barriers to abortion access for all Granite Staters through direct funding of abortion care, providing logistical support, and providing information and education relating to reproductive health in our state. I come before you all today to express my strong support for SB 399. The abortion ban and ultrasound mandate that went into effect on January 1st have already had harmful consequences for the organization I run. As an abortion fund that helps patients access critical care at all points in pregnancy, and particularly supports patients who are in financial distress, the abortion ban means patients will have to travel further and endure higher costs, not only for their procedures, but for things like hotel rooms, transportation, and childcare. This places a major burden not just on these patients, but on our organization's ability to meet the needs of these patients. To focus in on the ultrasound mandate, which I believe to be cruel and medically unnecessary, I'd like to give a brief overview of the current landscape of abortion care. As of right now, patients are able to receive abortion care through a wider variety of means than ever before. Since the year 2000, patients have been able to end a pregnancy using a combination of mifepristone and misoprostol, 5 easy pills taken over the course of 2 to 24 hours that induce a miscarriage.
Because of COVID restricting patients' access to in-person care, the FDA has approved MIFI and MISO for telemedicine prescription and administration. This means that patients can access providers via telehealth, go through a verbal intake process, and receive their abortion pills by mail, with some services costing patients only $150. This allows them to administer their abortions in the safety and comfort of their own home, surrounded by their chosen support systems and safe from a deadly communicable virus. Abortion pills are 95% effective and have a lower complication rate than Tylenol and Viagra. Not only that, but with a provider shortage, patients often have to wait several weeks to find an available appointment with an in-person provider. Here in New Hampshire, that means rural patients sometimes drive 2 to 4 hours to a clinic, risking exposure to COVID, taking time off work, finding childcare, and other expenses involved with accessing in-clinic care. These are massive barriers that we see patients struggle with every single day. Telehealth is the future of abortion care. During the COVID-19 pandemic, even clinics have innovated the way in which they provide abortion care and have shown how abortion can successfully occur without a patient needing to set foot into a clinic, reducing a huge barrier to access. Our homes, for those of us privileged enough to be housed and safe during this pandemic, have become safe havens, and many people prefer to have their abortions from the comfort and safety of their own home. The bottom line is, every patient deserves the full breadth of options available to them. Of course, there will be plenty of patients who prefer in-clinic care, and they also must be able to access that care without mandatory, invasive, and medically unnecessary ultrasounds. This mandate effectively eliminates a full process of healthcare that patients should be able to choose for access, forcing every single patient to walk into a clinic, which poses a massive barrier for many. The FDA has approved the use of medication abortion without ultrasound. Most states allow for it. Why should New Hampshire be behind and stand alone opposing modern medical standards that increase our bodily freedom and our right to choose how we access medicine? Thank you for your time. I'm happy to take questions.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you very much. The chair will call Kelly Omu, and after that is Juan, it looks like SAA? Good
Hello.
afternoon. Let me know when you're all ready.
I'm ready.
Okay.
My name is Kelly Omu. I'm 30 years old and I'm a resident of New Hampshire. And I'm very much wanted to start a family with my husband. I'm sharing my story about how difficult accessing abortion is, so you know how important it is for New Hampshire's abortion ban to be overturned. We found out in early October that we were expecting. I hemorrhaged at 9 weeks and went to the ER thinking I had witnessed a miscarriage. The next day, we saw the baby for the first time on that emergency ultrasound. It was not planned. We were so relieved to see it wiggling around and hear the heartbeat. About 5 minutes later, though, the physician came in to tell us the results. They showed us the hemorrhage and told me to take it easy and it should resolve on its own. She then told us we should follow up with genetics testing as the neck looked thicker than it should at this point in the pregnancy. The pit in my stomach sank, but we patiently waited for the results to see if the baby had any genetic conditions, deciding we would provide the baby with whatever it needed as long as we could be their parents. The results came back negative and for any genetic conditions, but yet again, at the next ultrasound, they told us the hemorrhage had healed, but the fetus had what appeared to be a fetal cystic hygroma behind its neck. With one more ultrasound 2 weeks later, it was determined that the fetus now showed signs of swelling. They then had to refer us to maternal fetal medicine at a hospital in Manchester 3 weeks later. A few weeks ago, when we went in and spent a decent amount of time with a genetics counselor who assured us this was most likely a very rare incident, since it wasn't genetic. During the ultrasound, we yet again received news that we didn't want to hear. We could either wait it out and come back 2 weeks later for further cardiac testing, see if the fetus passes naturally, or schedule a D&E, which is a procedure done in the second trimester to terminate the pregnancy. At that point, I was already 16 weeks. I decided to wait it out, but then my husband had asked if the baby will survive, even if the test determined the cause of the cystic hygroma. The doctor replied confidently, no. She then continued to share that the amount of swelling at this point in the pregnancy was fatal, and it really was up to us with what directions we wanted to go. After some talking to each other, we decided that the best thing for my body and this fetus was to terminate it soon. When I called a few days later and asked about the D&E, they referred me to only 2 options that I had. I was shocked. I work in healthcare. I only have 2 options. It was either Boston or Lebanon, neither of which are close to me. They told me it would take 2 days, requiring me to get a hotel and miss several days of work. I couldn't understand why I couldn't just get it done at the maternal fetal medicine office that I was there. They were the high-risk doctors. Why could they not do it? There was only one place in New Hampshire that would take me. They told me certain places don't perform them in the second trimester, and unfortunately it's due to politics. She didn't need to explain anything else after that. I've now had to be given a code word just to get into the clinic to keep myself and the staff safe from clinic harassers. I'm 18 weeks now and have to mourn the loss of a child. So does my husband and our family. Dealing with this pregnancy loss is hard enough, but having to navigate all these crazy hoops is too much. What if I had found out at 24 weeks? How much more difficult would this have been for me and my family? Where would I have gone? The last thing we should have to do is let the government in the exam room with us. I could keep going, there's more, but I just want to stop and say I've listened to everything today, and I don't think I'm doing anything wrong here. I'm doing what my doctors have said. I don't feel like it's safe to put my body through a further pregnancy to push out a stillborn. And you can ask me to my face if you think or you could tell me to my face if you think I should do that, but I wouldn't make you do it. And that's the thing, I want people to have the choice. You can have the choice to agree that abortion is bad and don't do it. But I should also have the choice then to say I needed this. It was medically necessary, and I should be allowed it.
Thank you very much for your testimony. Are there any questions from the committee? Senator French.
And thank you, Madam Chair, and thank you for coming today. I did read your testimony this afternoon in my office, and I want to tell you I feel really sorry for what you went through.
Thank you.
I did notice, though, you said 16 weeks and you had trouble getting the procedures you needed.
Mm-hmm.
Our law calls for 24 weeks. You're aware of that, right?
Oh, definitely.
So I don't see why you had a trouble unless the office you were at just chose not to do it.
Are you done? Sorry. The access in New Hampshire already is that slim that I only had one option in New Hampshire, and it was Dartmouth and Lebanon.
Got you.
Yep.
That I didn't
Yeah,
understand.
so even though it's legal for me to get it done at 24 weeks, I still can't even find it right now. I'm still pregnant.
Thank
and
you
she's
very
still
much.
growing. And the hygroma is now 3 times the size of her body, and she's struggling to have a heartbeat.
Thank you.
Any further questions? Okay, seeing none, thank you very much for your testimony
Thank
this
you.
afternoon. The chair will call Juan, is it Sa? Yep. Okay, and then after Mr. Sa is Alan Cook.
Thank you. I have a new appreciation for the work you do.
Let me know when you're ready.
Long hearing, thank you. I'm ready. My name is Juan Sa. I've been pastoring Lifeway Church in Derry for 20 years. And I'm here to oppose SB 399 for 3 reasons. A moral reason, a compassionate reason, and a cultural reason. The moral reason. There was a time when all of us in this room did not have a voice. And that's when we were all inside our mother's wombs. Our moms gave us a voice by delivering us into this world. If we would have been aborted, none of us would be here. But you are here. If you wouldn't be here, I think that would be wrong. And it's wrong because God values every life. He values each and every one of you. He values me and you, and even those babies inside the wombs. That's a fact. He loves them. In His Word, He states that we should not take what He has created human life is precious to him. That's the moral reason. And I trust that reason, as hard as it may be. The compassionate reason. A few years back, my oldest daughter, the darling of my heart, was taken advantage by a man. He was an illegal alien from Honduras. And many pressure was on her to terminate the pregnancy. It was a very difficult time for our family. In the midst of that, my family, my wife, and my other kids in our church stood behind her in prayer. And today, this baby is our first grandson, Danny, 4.5. He's going to be 4 in June, and he has been the delight of my heart. I myself had fears of seeing his face and reminding me of the man who hurt her so deeply, including us. But we have found that this baby has been a source of healing to her, to us, and an opportunity for the church to show compassion. God loves these kids, no matter what's going on inside, whether they were the result of trauma or assault, or if they have a physical disability. God loves them, and He has a plan for them and a purpose for them. And He has a body, God has a body on this earth, that's the church, and every one of those kids has an option that speaks life. The cultural reason, I believe New Hampshire is a beautiful state. Granite State is beautiful. But we do not have to have granite hearts. We can leave a legacy of life to our children, and I pray that we will ponder, and this time in history, we can leave a legacy of life for America and for the world, that New Hampshire stands for life and trusts in the plans of God, even when it doesn't make sense, because on the other side of that trust, there is hope, there's forgiveness, there's redemption, and I'm a true witness of that. Blessed is the land and the state whose God is the Lord. Thank you so much.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you very much.
Thank you.
The chair will call Alan Cook. Alan Cook. And then after Mr. Cook is Sarah Matsunaga. Mr. Cook, please come forward.
Just turning off my phone.
No, it's okay.
Thank you, Madam Chair and Committee, for allowing me to speak to this bill. I'm here on behalf of the unborn. My name is Alan Cook. I'm the senior pastor of Grace Ministries International in Brentwood, New Hampshire. I also had the privilege of serving our great state as a 2-term rep from Brentwood. Loved every moment of it, and it's great to be back in the halls of this house. New Hampshire is always a leader among her fellow states. The passage of the Fetal Life Act bill was a step promoting the preciousness, the dignity and value of life, particularly to the unborn. While other states at this moment, several of them, are spiraling to the lowest levels of protecting innocent life inside and outside of the womb, New Hampshire chose to move her people upwards towards the blessings of our national core values as presented in the Declaration of Independence: life, liberty, and the pursuit of happiness for all, whether born or unborn. I'd like to draw your attention to the incredible breakthroughs we have accomplished with UDO surgery in the last 20 years. Mayo Clinic, as well as Washington University School of Medicine in St. Louis and Children's Hospital of Philadelphia, are world-renowned for fetal surgeries, from tumor removals in the heart of the fetus, to spina bifida corrections, to lower urinary tract obstructions, and numerous other life-threatening illnesses. There is no logical reason to operate in utero if there is not a viable life to save or help in some medical way. The procedure of abortion is continually being challenged by one way, simply through the revelation of ultrasound technology. We can clearly see and record almost from the conception the incredible phenomenon of what we call a human being. That being exists and is vibrant and alive, as ultrasounds have shown over and over and over. The different types of ultrasounds will continue to reveal that we are all fearfully and wonderfully made. And I might add that fetal abnormalities can be taken care of through the knowledge we've gained now medically as a result of ultrasounds. As you know, as legislators, this past Monday was a day set aside to honor Dr. Martin Luther King. And what was he famous for? Of course, we all know, for civil rights to be given to his race. The reason he fought so hard for this was because his race had been denied acknowledgement by the society at large as not even being human and worthy of human rights. And in parallel, that is why abortion will eventually lose its dark grip of death on the consciousness of our nation. Through science and common decency, we are compelled to acknowledge the life of a child in the womb. It has taken many generations for Dr. King and those pioneers before him to change the thinking of those who opposed his very existence as a man. So it is with the unborn. It will take time, but the conscience of our society will once again acknowledge the basic human rights of a human in utero. In closing, I applaud the legislature of New Hampshire for bringing our state to the basic level of protection of the unborn, which is already in place in many other states. And I would leave you with one great quote. Cowardice asks the question, is it safe? Expediency asks the question, is it politically correct? Vanity asks the question, is it popular? But conscience asks the question, is it right? And there comes a time when one must take a position that is neither safe nor politically correct nor popular, but one must take it because it is right. Dr. Martin Luther King. Please take the position of medical advancement in regard to human beings in the utero and do what is right for them. Allow this law to stand. Thank you very much for your time.
Thank you very much for your testimony. Are there any questions from the committee? Okay, seeing none, thank you. The chair will call Sarah Matsunaga, and after that will be Sarah Marcu. Okay, let me know when you're ready.
Can you hear me okay?
Pardon?
Can you hear me okay?
Yep.
Okay, great. I'm ready.
Okay.
Hello, my name is Sarah Matsunaga. I'm a second-year medical student at Geisel School of Medicine at Dartmouth. In my 2 years of medical school so far, I've already witnessed so many incredible moments of trust and vulnerability between physicians, patients, and other healthcare workers, and I believe this current abortion ban interferes with that. To criminalize needed medical procedures, introduce fines and jail time for physicians doing their job and helping patients, or as is proposed by another bill in this House to create bounty hunters out of everyday people, threatens the honesty and trust required for the best clinical care. The law as currently stated requires ultrasound prior to all abortion care, even when not medically necessary. A requirement like this not only raises the cost of health care, but also fails to reflect the patient's individual circumstances. For example, prior to this law, providers could work with patients who had been sexually assaulted to decide whether an ultrasound was necessary before their abortion care. This law removes this flexibility and prohibits providers from delivering patient-centered, trauma-informed care. I believe an unintended consequence of our current 24-week abortion ban and others which seek to replicate or buttress it will be to discourage talented physicians from training and practicing in New Hampshire. My future OBGYN peers and myself are interested in this career exactly because of our passion for reproductive justice and reproductive health access for all. Why practice in an environment in which the government intentionally impairs your ability to practice shared decision-making with your patients and threatens you with up to 7 years in prison for doing your job? Why practice in an environment where you must tell your patients at their most vulnerable moments that they need to seek care out of state if they can afford it? To vote against this bill could erode the reputation and quality of future OBGYN healthcare of New Hampshire. And before I leave, I hope to impart the Senate with a sense of the diversity of patients seeking abortion care and why the flexibility for individuals to make their own informed healthcare decisions must be reflected in our laws. 1 in 4 American women will have an abortion by the age of 45, and the folks who receive abortion care are diverse. Each has a different story. Though abortions later in pregnancy are rare, only about 1% are performed after 21 weeks, they're essential in circumstances such as new health risks to the pregnant person and emerging medical knowledge about the pregnancy. The current law removes freedom of choice and allows no exceptions, not for rape, incest, or fatal fetal diagnoses. No pregnancy is the same, and every individual deserves to have all options available to them. So please support these bills.
Thank you very much for your testimony. Are there any questions from the committee? Senator Cont.
Thank you, Madam Chair, and thank you for taking time to be with us. You are, I think, a student at DH, so you're the model of and subject of previous questions. So what state did you graduate your undergraduate from? And where's your permanent residence?
Well, I'm originally from Hawaii, and I went to school at Stanford in California, and then I came here for medical school.
Yeah, that's, I think, what we would expect. It's an outstanding school, with previous testimony. Thank you, Madam Chair. The question about where you might practice, and I guess we ought to know, where in your medical education are you? Are you still a graduate student, or?
Yeah, I'm currently in my second year, so very soon I'll be in the clinical environment, working with patients, working at Dartmouth at the OBGYN Center.
I guess can I follow with a couple more questions?
Yes.
So, do you have a specialty that you're interested in?
I have a few, but among them I would say OBGYN is very high up there.
Yeah. And is the current state of statutes in New Hampshire relative to a 24-week ban and the use of, with very few exceptions, I mean, one possible exception, certainly not accepting fatal fetal anomalies, that together with the ultrasound requirement to establish gestational age, are those factors influencing your choice either of the specialty or of where you might seek a residency or to practice in the future?
I believe so. I think as a medical student, a prospective OBGYN physician, I'm looking for an environment in which I can maintain the kind of clinical atmosphere that I think is necessary, one which I can directly work with patients and not have to tell them to seek care out of state, and one in which I feel safe practicing. And my concern is that some of the conversations had today contribute to the inflammatory nature of this subject and continue to make some abortion providers feel unsafe doing their job.
But in short, this will influence your decision about where to practice.
Certainly.
One more? Okay.
I didn't want to paraphrase your remarks, but essentially, is this a chilling to the environment for OBGYN, but OB obstetric practitioners in the state?
Yeah, I believe so. I don't consider this to be a moderate bill because I think the idea of telling a person who's carrying a fetus with a fatal fetal diagnosis that they either must carry that fetus to term or scrounge up the money, go out of state, seek care elsewhere, I don't think I think it's a very difficult thing to say to a patient.
Thank you for your testimony.
Are there any further questions? I just have a quick question. You answered Senator Cont that you would have difficulty, I'm just going to paraphrase and say have difficulty deciding to work in New Hampshire because of the law and the chilling effect it has upon doctors. But would you say the same thing about practicing in California, which basically has the same type of criminal penalties for an OBGYN?
Well, so I'd like to say that is a decision that I will have to make later in my career as these bills, kind of advance and things settle down. I think that as I'm choosing a place to practice, if I do end up going into OBGYN care, the laws and the criminal statutes will be something that I look at that time.
Okay, thank you. Are there any further questions? Seeing none, thank you very much for your testimony.
Thank you so much.
The chair will call Sarah Marcu, and after Sarah is Samantha Marcu. Good afternoon.
Hello.
Let me know when you're ready to start.
Sure. All set. Thank you. Thank you for taking the time to hear my
Could
testimony
you come
today.
forward to speak into the microphone so we can hear you? Thank you.
Sorry. Thank you for taking the time to hear my testimony today. My name is Sarah Marcu. I'm from Northfield, and I oppose this bill. When I was 24 weeks pregnant with my daughter, I was sent for genetic testing due to abnormalities in an ultrasound. They determined that she had microcephaly, a hole in her heart, a slew of genetic diseases, and we were told that if she ever did manage to survive birth, that she would not ever walk or talk. We were told that we needed to abort her, and we declined. Immediately following, another doctor came running in and said, "You don't understand the severity. You're at 24 weeks, and at 25 weeks, we will be required to resuscitate her. So you have to make this decision." And again, I declined. It was never a choice for me because I am a firm believer in the sanctity of life. But I've often wondered about those who waver, those who don't have a strong moral compass, or those who are just plain scared and confused, which I also understand because, you see, I also was a teenage parent. Had I given in to the pressure because of my age, I would have robbed this world of an amazing young man. And later, if I'd given in to the pressure of those in the medical field who were so insistent that they were right, this world would miss an incredible young woman who you'll hear from in a moment. If you take the time to listen, there is a moral outcry from your constituents, and it is being drowned out by corporations with an agenda and seemingly endless money to throw at their cause. They are losing ground across the country. And because so, they are funneling money into our state because they think that we are a pushover. Without even bringing into this discussion today the lack of constitutional merit, the massive human rights issue, the emotional trauma that post-abortive family members live with, or the physical trauma and increased cancer rates that post-abortive mothers face, it's time to take every possible step forward toward halting abortion, simply because it's the right thing to do. If it means allowing an ultrasound, then that's okay. There are a lot of us who would rather 24 weeks. There are a lot of us who would rather it be much sooner. But we also understand that there's a compromise. And so at this point, we're just asking you to please keep the 24 weeks. Mothers and babies both deserve this. It's time to stop allowing doctors to push their own prejudices and ideas onto the very vulnerable patients at the expense of human life. We are better than this. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair will call Samantha Marcu, and after that, Shannon McGinley. Okay. Let me know when you're ready to start. And if you could come forward to speak into the microphone.
Ready to start?
Yep, I'm all set.
My name is Samantha Marcu, and I'm 17 years old. I'm from Northfield, and I oppose this bill. Knowing I could have been aborted based off of a diagnosis that wasn't even correct makes it honestly surprising to me that I'm even standing here today, especially considering the fact that so many others are not as lucky. No medical test could say that I love reading and writing, or show that I like doing puzzles. No one could tell that no one could tell my family and my friends that I'm creative or that I like agriculture. They could not say who I am as a person. Everything I ever have done and ever will do, I got the opportunity to do because I was not aborted. That is an opportunity that everyone should have, but unfortunately, not everyone does. The Fetal Life Protection Act should remain in place. It cannot determine the fate of a child before 24 weeks gestation, but it can protect those beyond 6 months of pregnancy after a child is able to feel pain.
Thank you very much for your testimony. Are there any questions? Senator Cont.
Thank you, Madam Chair. I simply want to thank you. I admire your courage to be with us today and to share your appreciation of life. Thank you.
Are there any further questions? Okay. Seeing none, thank you very much. The chair will call Shannon McGinley and then Star Covey. When you're all set, when you're ready, let me know.
All right. Thank you, Chairman Carson and members of the committee for giving me this opportunity to speak to you today. It's been said, my name is Shannon McGinley. I'm from Bedford, and I'm here to speak in opposition of SB 399. We've heard it said several times today that New Hampshire will have difficulty recruiting physicians because of this law. And as Attorney Ian Hewitt from Cornerstone Action mentioned earlier, that Massachusetts had a 6-month felony ban right up until December of 2020. And that law at that time had no rape and incest exceptions, no fetal anomaly exceptions, and it did have felony penalties. In early 2021, within 2 months of the repeal of that law in Massachusetts, U.S. News and World Report ranked Massachusetts as number 2 in the country for healthcare. It does not seem that their law that was on the books for many years impacted their ability to recruit physicians. I think it's fair to say right now, we all know family, friends that work in the healthcare industry, and that yes, it is a challenge right now for recruitment broadly speaking. And so I don't think that it's fair to specifically say that the challenge with recruitment is because of this law. Massachusetts arguably provides some of the best health care in the world. And so they continue to do so after all of these years. It's also been said that abortions are rarely done in the 3rd trimester of pregnancy, but we have to take them at their word because it seems that abortion providers in New Hampshire continue to change their story as to whether they are rare or that it's something that they absolutely have to have because it is so common. So I think that was all. I just wanted to clarify those statements that were made earlier.
Okay, thank you very much for your testimony. Are there any questions for Ms. McGinley? Okay, seeing none.
Thank you
very much.
Also, I have written testimony from Representative Linda Gould, who needed to leave to go to committee. So
if you could please give them to Ms. Horgan, that would be terrific. The chair will call Star Covey. Let me know when you're ready.
Okay.
There we go.
My name is Star Covey. I'm from Hillsborough, New Hampshire. Thank you for giving me the opportunity to speak today. Basically, before this bill, first off, I oppose, 399, but I am in support of the bill that's already been in place. So before this bill, you used to be able to have an abortion in New Hampshire at any gestation for any reason. And since this bill has passed, it puts restrictions on the gestation. And any non-medical reason after 24 weeks does become unlawful. But the bill leaves it open to medical emergency reasons for the mother's life. The bill is also requiring doctors to use ultrasound in order to perform these abortions. The bill doesn't require a doctor to reveal the ultrasound to the patient. The reason an ultrasound is needed is so that they can know for sure what the gestation of the child is, but it also doubles for safety for the woman. Opponents of this bill are calling ultrasounds invasive, which is absolutely ridiculous to me because an abortion itself is extremely invasive. The tools used can harm a woman while removing the child from her womb, and anyone fighting against an abortion provider having to use an ultrasound during an abortion clearly is not for the safety of a woman. The bill doesn't really change the rape or incest part because you can still get an abortion up to 24 weeks, which is 6 months, as part of this bill. And most people know that they are pregnant long before then, especially if it's been after rape or incest. Statistically speaking, something like over 80% of all abortions are under 10 weeks. Personally, as a post-abortive mother who is now pro-life, I can see that this bill doesn't change much in the laws that are already in place, other than holding abortion providers accountable for the safety of a woman and her child. The name of this bill is called the Fetal Protection Act, but it only protects babies after 6 months. So clearly, this is a bill that both pro-life and pro-abortion advocates somehow need to meet in some sort of understanding to establish the rights of a child. And that's all.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you. Okay, we've gone through everyone who had signed up that wished to speak. Are there any other members of the public that would like to speak to Senate Bill 339? Okay, seeing none, I'm going to close the public hearing, and the committee will be in recess for 10 minutes. You got a snack. Jenny? Here you go. Yeah, she's been snacking all along. No, I'm all set. I ate a good lunch, and I've got to go to the other place.
Like the loaves and the fishes. I would eat the whole thing. No,
You were born in 1980. What's the word? March 18th. She's born in 1860. You don't look it. I thought you were like.
Well, I'd be on the first 3/4 of the year. Yes.
hearing on Senate Bill 436. We call the prime sponsor, Senators Perkins Coca. Just to remind everyone, it's now 4:30, and so our staff is going to be staying late to work with us. So we're going to do the same rules that we had for the other public hearing. 3 minutes. Please do not repeat testimony that we've already heard. Please do not read testimony. If you have testimony, please submit it to our secretary. She will make sure that we all are given copies of it. This bill is not being exec today, so we will have plenty of opportunity to read your emails and your testimony. Thank you. So, Senator Perkins Coca, welcome to Senate Judiciary.
Yeah, thank you, Senator Carson. Nice to be here. Hello, my committee members. For the record, I'm Senator Rebecca Perkins Coca, proudly representing Senate District 21. I am here today as the prime sponsor of Senate Bill 436, the Access to Abortion Care Act, which I'm very proud to introduce. We know that reproductive rights and freedoms have never been more imperiled than they are right now. At the national level, we have the U.S. Supreme Court poised to dismantle the right to abortion afforded to women by the Roe v. Wade decision as soon as June of this year. Immediately upon this decision, states will have banned abortion or deeply restricted access in as many as 26 states. Half of the country may not be able to access legal abortion in their own home state. To be clear, in 6 months, Roe v. Wade will most likely no longer be the law of the land after nearly 50 years. Right now in New Hampshire, there is nothing in place to ensure the right to have an abortion. The Access to Abortion Care Act would put abortion rights into statute in New Hampshire. If passed into law, abortion would remain safe, legal, and accessible in most cases in New Hampshire, regardless of what happens at the Supreme Court. It's important to note here that despite anti-choice legislation passed in the budget last year, Granite Staters, by and large, strongly support access to safe and legal abortion. Nationally, 8 in 10 Americans support Roe v. Wade. According to polling, even a majority of Republicans and conservatives, and 75% of Americans generally, believe that abortion should be a private decision between a woman and her doctor. It's also important to note that while I remain deeply opposed to the 24-week ban and mandatory ultrasound requirement passed last year, the legislation before you does not seek to repeal or amend the ban in any way. This legislation specifically honors existing state law and does not seek to override it. What it does seek to do is enshrine in our state statutes the right to a safe and legal abortion up to 24 weeks of pregnancy. The right to a safe and legal abortion is paramount for women. The World Health Organization readily acknowledges that putting legal restrictions on abortion does not actually reduce abortions. Much like how prohibition drove people into speakeasies and created a black market for alcohol, the fall of Roe v. Wade without state-level safeguards in place will just force pregnant women to seek riskier alternatives to traditional abortion care or force them to travel thousands of miles out of state if they can afford it, jeopardizing their lives and their reproductive futures. The Turnaway study is put out by the University of California, San Francisco, and it is a longitudinal study examining the effects of unwanted pregnancy on women's lives. Unsurprisingly, being denied an abortion results in worse financial, health, and family outcomes. Women who are denied an abortion or forced to carry an unwanted pregnancy to term are 4 times more likely to live below the federal poverty level, more likely to experience serious complications from the end of pregnancy, such as eclampsia and death, more likely to stay with abusive partners, more likely to experience poor physical health for years after pregnancy, including chronic pain and gestational hypertension. It also finds that being denied an abortion has serious implications for the children born of unwanted pregnancy, as well as for the existing children in the family. All of these outcomes, while devastating for the woman herself, have ripple effects that will negatively impact our economy, our society, and generations to come. I know that this is a personal issue. I know that when we talk about abortion care, emotions run high and beliefs are strongly held. But please, hear us as we hear you. Hear that we truly believe a woman is in the best position to make this decision. Hear our trust in a woman as a caregiver, as a decision maker, and as a person who has the right, just as you do, to plan her life, who may find herself trapped by a partner or a relative, who may know that a decision to have an abortion, while potentially traumatic itself, will allow her to truly be the mother she can be at a time when she can support her child, who may believe as deeply and truly as you may hold other beliefs that being forced to carry a pregnancy for her own deeply held reasons is wrong. This is not an abstract issue. I wish I could tell you that it was. In my very own life, I've been impacted by pregnancy trauma around me, and I know the emotional depth of this issue. I spoke to you last year about the fear I felt each day of my pregnancy, and I am lucky. My daughter survived to term, and so far she is a healthy, almost 5-month-old. But I counted the days of each of my pregnancies after hearing stories of babies who passed in utero, friends who went into labor at 15 weeks and faced a dangerous miscarriage, coworkers who still think about a decision they made 15 or 20 years ago when they were just children themselves. Women are people. They have feelings and wants and needs, and we cannot expect them to bear our children without showing them a deep respect that such a responsibility bestows. An abortion is not a passing moment in time. It is a layer in our experience that shapes and defines us as humans, just as pregnancy is and just as being a parent is. I know there are parents in this room who are deeply devoted to their children, and that is the dream, that we together as policymakers can enable each of our members of our society to thrive and to raise a new generation that will thrive. The alternative is that we deprive half of our society of their rights and in turn create ripples and tides of unintended consequences when we could have respected them all along. You have already limited access to abortion in New Hampshire. Now is the time to codify the right to the extent you have allowed to an abortion in New Hampshire. Time is of the essence. Thank you for your time, and I'm happy to take any questions.
Thank you very much for your testimony this afternoon, Senator, and just to also thank you for waiting. The first public hearing took a little bit longer, but thank you for waiting.
Yeah, thank you guys for hearing
Are there
it.
any questions? Senator Gannon.
I'll be real quick. So you're going to recognize the 24-week thing. What about as science and technology, everything involves, these doctors are real smart, and now it's 21 weeks they're delivering out alive. So is that like an evolving paradigm? We're going to keep going lower and your bill would recognize that, or are you locked in at 24 weeks?
The only exception in our legislation to a right to terminate a pregnancy is to recognize the existing law that was passed last year. So we're recognizing existing state law while asking to protect a woman's right as broadly as we can.
Thank you.
Okay, are there any further questions? Oh, Senator Khan and then Senator Whitley.
She saw me first, Senator Perkins.
Sorry, I'm always looking at you, Senator Khan.
Thank you.
Your
Thank
hand
you.
is a little sneaky there every
Thank you,
once in a
Madam
while.
Chair. So we've seen at the Executive Council level decisions to defund entities that might provide information about abortion care that as an option. And so here's an act that is assuring that access be provided. Can you envision what, if this was in place, what the difference would be for funding and access to abortion care?
Sure. I think at a fundamental level, it provides certainty to our providers and to our residents. And so by affirming as a legislature that we do respect this right of a woman that's been in place for almost 50 years now, we address to some degree what has become a real concern on the part of providers, especially in continuing their practice in our state, where as we erode, the rights of a woman to abortion care, they are unable to be certain they'll be able to practice their career here. And I think, as a clear policy signal by the legislature, it certainly encourages our other policymaking bodies to administer and execute on that right that we as the legislature has created, which is their function within the executive department.
Thank you.
Senator Whitley.
Thank you, Madam Chair. Thank you, Senator, for your testimony today. So you spoke a little bit about why it's so necessary right now to put these protections in place for New Hampshire women and pregnant people. So I'm wondering if you can identify, why this is necessary now. What is it about sort of the national landscape that makes it such a critical thing for us to do in New Hampshire?
Yeah, thank you for the question, Senator Whitley. It's our Supreme Court. So the right to an abortion is protected by Roe versus Wade. That's a Supreme Court holding that's been in place for almost 50 years. If that decision were to be overturned or narrowed, which is a distinct possibility in the Supreme Court session, Granite State women would be unprotected. And so the rights that many of us have known, in my case since before I was born, would no longer exist. And so passing this bill is a way that we can ensure that the New Hampshire women that are used to having that right, planning their lives with that right, and making the decisions they need to make about their family would continue to enjoy that right. And so it's our responsibility as policymakers to be proactive about that and ensure that we're anticipating what might happen at the Supreme Court.
Follow up?
Thank you, Madam Chair, and thank you for taking another question. I was born in New Hampshire. I think you were born in New Hampshire.
I was.
We are both mothers. And so I'm wondering if you can describe how this was written and how it aligns with New Hampshire values regarding freedom, individuality, the ability to determine your future. I'm wondering how this aligns, your desire to submit this bill, how does it align with those values that we know and carry so deeply?
Sure. The polling is clear that a majority of Granite Staters do believe that a woman's right to choose and her reproductive freedom is her decision, and it's a decision between her and her doctor. Traditionally, here in the Granite State, I know that we have been about respecting individual rights and acknowledging that each member of our society is equal and that we each do our best in our daily lives. And I think as policymakers, I know I didn't come to Concord to restrict those rights. I certainly respect each Granite Stater to make that decision. And so I think that this bill aligns perfectly with what I've always known New Hampshire values to be, which are, that we respect each other and we let each other carry on our lives as we will.
Okay, are there any first? Senator Gannon?
Just a quick question. So you brought up Roe. If Roe is gone, wouldn't you say that we should look at when life begins? Shouldn't we have a policy committee? Because you're just going to say it's 24 weeks. Shouldn't we bring biologists? I've had doctors today testify life begins at conception. I think some others said, more like towards when it's a fetus. Shouldn't we examine it rather than just, we'll go 24 weeks? I know it's the Roe decision, and that's the other bill, but wouldn't we be better off examining when we want to say the state has an interest in human life, which Roe says at 24 weeks? If that's gone, do we want to maybe meet and have committees to examine, have medical experts telling us when life begins, and as a state look at that?
With all due respect, Senator Gannon, I don't know that, you don't know that, and no committee would know it either. Each pregnancy is different. New information can always be learned at any time, and I think, the reason I'm bringing this bill is because I understand that we can't legislate this decision. It's absolutely between a woman and her doctor, and the doctor is in the best position to assess her medical needs.
Quick follow-up?
Yes, please.
So you're saying that individually, we're going to all each woman is going to make her decision when she believes life begins. So we're going to have a very random thing where one person may say 15 weeks, and I see if different people are making different decisions, it's going to be very hard for the state to, 15 weeks, 20 weeks, 24 weeks. There's no rules, there's no boundaries. I have a hard time. It's going to be the Wild West of abortion. You'll go to one doctor and they'll, geez, 20 weeks, it's fully developed. I think you're not giving direction.
With all due respect, Senator Gannon, that's exactly the point. We don't need to be giving direction to New Hampshire women how to make decisions about their own body and their own lives.
Thank you.
Senator Whitley.
Thank you, Madam Chair. Just sort of following up on Senator Gannon's line of questioning, and just to be clear, you're also a lawyer. Roe doesn't specifically say 24 weeks, correct?
Correct.
Liability, I believe.
Correct. So Roe does establish a viability framework that's expanded on by additional cases, but isn't it very true? We heard, everyone who is following what's happening in the Supreme Court, Roe itself might be going away soon, correct?
We heard that Roe itself could be going away. And to be clear, this bill enshrines what is a woman's rights today in New Hampshire. So today, a woman could seek an abortion up to 24 weeks. This bill respects the ban that was put in place last year, but that ban was the first time in New Hampshire history that we've ever limited a woman's right to an abortion here in the Granite State.
Senator Khan.
Thank you, Madam Chair. Thank you, Senator. One more question for you.
Yeah.
As I read this bill, I don't see that there's a temporal time frame suggested here. It's a policy guidance that stands regardless of what the time period might be. It seems like this question of timing is irrelevant to the point of your bill.
That's right. That's right. The language of this bill does not talk about timing at all. The only reference that we have in this conversation to a 24-week ban is because this bill merely encodes the right to terminate a pregnancy through abortion care with an exception for existing state law, which was passed last year. Should that exception go away, then that right would be, as it was a year ago, a woman's decision between herself and her doctor.
Thank you.
Hey,
Quick
Senator
follow-up.
Gannon.
I'm sorry.
Yes, sir.
Okay, so if the last bill passes, then, and your bill passes, then a woman could get an abortion right up to birth at full term?
Senator Gannon, as I mentioned before, these are highly personal decisions between a woman and her doctor. And so what a woman may choose to do probably factors in all the circumstances. If both bills were to pass, it is true that our rights would go back to the same way they were a year ago, that a woman would have the right to terminate a pregnancy.
Thank you.
Okay. Are there any further questions? Seeing none, thank you very much, Senator.
Thank you very much.
The chair will call Representative Stapleton. And Representative, we're going to do the 3-minute thing again.
Pardon me.
3 minutes.
Okay.
And let me know when you're ready.
Thank you, Madam Chair, and thank you, members of the Senate Judiciary Committee. I'm Walt Stapleton from Claremont, Ward 3, Sullivan County, District 5. I rise in opposition to Bill SB 436FN. 436FN is flawed. Abortion is not really care. It is instead a procedure that terminates human life in the womb. And other than being performed to save the life or essential functional health of the mother or for a medical emergency, is really a wanton destruction of nascent human life. The bill states that abortion may not be restricted except as provided in RSA 329:44 and RSA 132.32 to RSA 132:36. But it omits RSA 329:32 through 42, the Partial Birth Abortion Protection Act, or Partial Birth Abortion Ban Act, and the RSA 132:23 to 23, Live Birth Infants Protection Act. Such sections speak for context in the discussion to the intent of our law in the Fetal Protection Act to protect life in the womb, which this bill would effectively disable. And further focus within that RSA 329:41 in the Partial Birth Abortion Ban Act. Nothing in this subdivision shall be construed as creating or recognizing a right to abortion. I mention these for some context. But the problem is
that those are ignored? And are we going to confront existing law with a bill that cherry picks what sections of law can be utilized to justify and enable an abortion? An overwhelming number of my constituents oppose any tampering, dilution, or detriment to the Fetal Life Protection Act that passed House, Senate, and approved by the governor and effective on January 1, 2022. So please, ITL this bill inexpedient to legislate, because it will have a great deal of destruction on the order and the value for life in the state of New Hampshire.
Thank you very much, Representative. Are there any questions for the representative? Okay, seeing none, thank you very much.
Thank you.
Okay, the chair will call Jason Hennessey. Let me know when you're ready to start. Okay.
Thank you, Madam Chair. My name is Jason Hennessey. I am here representing thousands of pro-life New Hampshire residents as the president of New Hampshire Right to Life. I'm also a published scientist with a PhD in computational sciences and statistics, as well as a resident of Amherst, New Hampshire. And I'm here to say that New Hampshire Right to Life opposes SB 436. And there's two reasons for this, practical and to the substance. From a practical perspective, this is really a solution in search of a problem. The bill itself does not actually accomplish anything, because what would happen is that any future bill that were to add some sort of restriction on abortion would just amend this RSA to exempt it or to nullify it or whatever. We typically don't pass laws just to say that we agree or disagree on some sort of theory that doesn't have any practical implications. I mean, maybe we do for things like the state tree or the state confectionery or flour, but not for things of weighty substance. So as to the substance, earlier I testified that I'd like you to ask yourself two questions. First, who is a person? And the second one is, what rights do people deserve? For many pro-life New Hampshire residents, just like slavery, this bill would deny the humanity of certain persons. It doesn't actually even mention them. There's no mention of unborn people in this bill, from what I remember. But medical science tells us that at conception, there's a human person that has all of the genetic material that they'll need to grow and prosper. For most of human history, an unborn child has been recognized as a person with rights. And as an example, the ancient Hippocratic Oath forbids physicians from doing abortion. Just like the oppressors of the past, this bill tries to steer the conversation away from giving equitable treatment to everyone involved and focuses only on one perspective. This is much like John Calhoun, who referred to human slavery as a peculiar institution to avoid saying things like human enslavement. If passed, SB 436 would record oppression into New Hampshire law. New Hampshire leads the nation in several areas, and this is a big part of the reason why I love to live here. Let's not lead the nation by being one of the first states to enshrine oppression of unborn human rights. I also want to respond to earlier testimony by saying that New Hampshire has a safe haven law, meaning that a mother who may be economically disadvantaged is free to give up her baby if she doesn't think she can raise it. And with that, I would love to take any questions.
Thank you very much for your testimony. Are there any questions from the committee? Okay. Senator Whitley?
Yeah, so I just wanted to clarify your statement about that future restrictions would have to amend this statute. But wouldn't it be the case that any future restriction, other than what's already in law, would be prohibited because of this statute if it passed?
Well, so Senator, thank you for the question. Any law, as you know much better than I do, each bill has the list of RSAs that they amend. And so, if anybody is writing an RSA in the future that would restrict abortion, it would just, this bill, if it were to be adopted, it would just mean that you would have to include a bill that says amend whatever this RSA is to either exempt this or whatever. So it would just add extra boilerplate to whatever bill happened to be there.
Okay, you're all set. Okay, seeing no further questions, thank you very much for your testimony this afternoon.
Thank you, Madam Chair.
Okay, next we're going to go to Devin Quinn. Okay, let me know when you're ready.
I'm ready. I'm Devin Quinn. I'm the Policy Director for the New Hampshire Women's Foundation, and I'm here in support of SB 436. In the interest of all of your time, I won't repeat my testimony in favor of SB 399 that I came back here for. Just to say that I came here earlier to say that to point out the particular inequities that an abortion ban would have on certain members of our community, and also the economic impact on women and their families that an abortion ban would have. To build on that for here in SB 436, I want to also talk about the social determinants of health that are impacted positively by women's and people's rights to choose. The New Hampshire Women's Foundation supports SB 436 because we believe that women and all people who can become pregnant should have access to the full range of reproductive choices, including abortion. We believe that it is crucial that New Hampshire take this step now because women cannot wait to find out what happens at the federal level. We must make a commitment to New Hampshire women to safe, legal, and accessible abortion care in our state. We believe women have the right to make decisions about their bodies, their families, and their lives. Not only is the choice to end a pregnancy a right, but it is for some a means to economic prosperity, safety, to the ability to flee violence, and the opportunity to pursue dreams and develop thriving communities, and for some the chance to protect their own health. In New Hampshire, women are more likely to live in poverty than men, with a gendered wage gap that increases by race, ethnicity, and county, and women are more likely to have been impacted by interpersonal violence and by sexual violence. These social determinants of health are all significantly impacted by the ability to make reproductive decisions for oneself, including abortion. The right to seek abortion is central to women's autonomy, health, wellness, economic security, and the ability to be active members of thriving families and communities in our state. Thank you, and I have written testimony as well.
Thank you very much for your testimony. Are there any questions?
go first.
Senator Whitley, then Senator Gannon.
Thank you, Madam Chair, and thank you, Devin, for taking my question. I was born again after Roe was decided. I had the ability to go to college, go to law school, become a senator, have a child when I was ready, even get married when I was ready, and have the career that I always dreamed of. But I'm also a white woman with my own set of privileges. And even though I was afforded these rights under Roe, we still know that abortion restrictions were permitted, where the Supreme Court did allow, and states still did pass abortion restrictions. So I'm wondering, you spoke specifically about social determinants of health. I'm wondering what populations are harmed the most by abortion restrictions?
Sure, and I'd love to also be an additional resource to all of you through our research that we have on our website, the New Hampshire Women's Foundation. We just released the status of girls. It's actually all in your mailboxes today. And the status of women as well. That really breaks down this data so we can actually have a robust conversation about who is in New Hampshire, who are the women and girls of New Hampshire who would be impacted by this. As I mentioned earlier, restrictions on abortion and access to reproductive care are going to harm, more specifically, women of color, low-income women, women whose primary language is not English, the LGBT community, rural communities who can't access care. So the social determinants of health are also impacted by these things as well. And so it's part of a holistic idea of health. Reproductive health care is one part of an overall health. It's not just about the care you got at the doctor's office, but how you access that care as well.
Are you all set? Yeah. Senator Gannon.
Thank you. Thanks for taking my question. You have a lot of expertise in the area, so you probably will have numbers. You and Senator Whitley both brought up race, abortion access, like inequalities. What about the impact? What I mean is abortions are much more likely to take effect if you both have brought up black women. So their abortion percentage are 500% higher. So it seems, I feel bad for the black community that we're taking away all these young, small babies of the future. Do you see that the impact is of abortion to the Black community, cutting their population, really?
Sure, I understand what you're saying. But I would say that it's much more, what I'm saying is that it is so important for women and people who can become pregnant in Black communities, in Hispanic communities, and communities of color to have access to the care that they need. And if that access is limited, that is harmful to those populations.
Okay, thank you.
Okay, are there any further questions? Seeing none, you had said that you would prepare
Yes.
some information with statistics and things
yeah.
like that. If you would do that, and please send it to Ms. Horgan, and she will ensure that we all will get a copy of it.
Excellent, thank you very much.
Thank you very much. Okay, next we are going to Liz Canada. Did I get that correct?
You did, just like the country.
Well, that's what I thought, but sometimes people put a little twist on it, and it's...
I know, it sometimes looks too easy, and so you go the other way.
Yeah, sometimes that happens. Okay, let me know when you're all set.
Sure thing, thank you. Okay, so good afternoon, honorable members of the Senate Judiciary Committee. My name's Liz Canada. I'm the Advocacy Manager at Planned Parenthood of Northern New England and Planned Parenthood New Hampshire Action Fund. We're here in strong support of Senate Bill 436, the Access to Abortion Care Act. And quite a few speakers today have already set the stage for you, but very briefly, by June of this year, 5 months from now, the U.S. Supreme Court could overturn the landmark Roe v. Wade decision, which would result in up to 26 states immediately acting or moving to ban abortion outright. And that's not hyperbole, and it's not a scare tactic. We're talking about 36 million women, half of the women in the United States of reproductive age, losing access to abortion care in their home state within the year. And we're already seeing what that looks like in Texas, which we heard Dr. Cass talk about earlier. On September 1st, Texas enacted a 6-week abortion ban, and patients have had to leave the state to access the care that they need. And I want to be clear that here in New Hampshire, health centers have already seen patients from Texas since that ban was enacted. As more states move to ban abortion, patients, only if they have the money, the child care, and time off of work, will be able to travel across state lines to access their care. But for so many more, they will be forced to remain pregnant and to carry and continue their pregnancy against their will because they won't be able to access that care. And I want to be clear that there's no one type of abortion story. There's not one example I can give you that represents everybody. But what we do know is that 1 in 4 women in the U.S. will have an abortion by the time she's 45 years old. We know that nationally, 60% of abortion patients are in their 20s. 59% already have a child. And 24% identify as Catholic, for example. They come from all different faith backgrounds, all sorts of different backgrounds. We just heard from the Women's Foundation as well. Because there is no one story and no one type of abortion patient. Here in New Hampshire, for decades, we have enjoyed broad bipartisan support of reproductive rights and access to abortion. That support has been shown through polls of voters, of course, but also in our elected leaders. In 1997, then Governor Shaheen signed into law the repealing of the pre-Roe abortion restrictions, but she did that with Republican majorities in both the House and the Senate. Those are the folks who sent her that bill to sign. Because abortion access is not a blue issue or a red issue. We're talking about essential health care that should be accessible to people who are seeking it. What we have now in front of you, Senate Bill 436, what you have, is an opportunity for New Hampshire to enshrine the tenets of the Roe v. Wade decision into law, which is something the majority of Granite Staters want. This bill, as you've heard others say, does not change the current restrictions on the books. It doesn't touch anything, it doesn't amend anything that's on the books. It's just enshrining that right into state law. The statutes are in place. Instead, we're talking about enshrining a person's ability to access abortion, prohibiting the government from further interfering in a person's access to abortion. New Hampshire needs to provide critical protections to ensure that Granite State women and families can work with their doctors to get the health care they need in the majority of situations. And we would urge you to pass this bill. Thank you.
Thank you very much for your testimony. Are there any questions? I have a, go ahead, Senator Whitley. No, please.
Thank you, Madam Chair, and thank you, Liz, for your testimony. Did you also pass out this letter?
Yes, thank you. So I had 2 items for you, written testimony and then a coalition letter of organizations in support of this legislation.
Can you describe the makeup of this coalition?
Sure, so it's a variety of different organizations. So you have healthcare providers, you have nonprofit organizations. So broad support, coalition of individuals across the state who are in support of enshrining these tenets of Roe v. Wade into law. And again, not touching any of the restrictions on the books right now.
Thank you. One of the questions I have, we've heard a lot of testimony about real concern that whatever the Supreme Court decides that they're going to do away with abortion rights, do you feel that Senate Bill 436 is preemptive, being that we're going to enshrine a woman's right to get abortion irregardless of whatever the Supreme Court decides?
I don't think it's preemptive. I think New Hampshire doesn't wait for DC to make decisions to be able to take those steps, and this is absolutely what Granite Staters want to see, and is the right step for Granite State patients right now.
Okay. Can you also supply the committee with the bill number of the repeal?
Yes,
of the
from
abortion ban
1997?
language?
Absolutely. Yes,
if you could do
absolutely.
that, and please give that information to our secretary.
I'd be happy to do that.
Okay. Are there any further questions? Okay. Seeing none, thank you very much. Okay, next we're going to hear from Frank Knack.
Good afternoon, Madam Chair, members of the committee. My name is Frank Knack with the ACLU of New Hampshire. So I think.
Oh, I'm sorry.
I'm sorry.
Okay.
Thank you. So I just want to kind of give a little context for the kind of political project to move away from access to abortion that we're seeing around the country right now. You know, Texas, Alabama, South Carolina didn't start with 6-week bans. They didn't start with trigger bans. They started with 20-week bans. They started with mandatory ultrasounds. They started with trap laws, things that we're seeing happen in New Hampshire today. And so what this bill does, it gets in front of the issue of denying access to abortion care, which is part of the political project that we're seeing across the country right now. You know, we feel that no one should be forced to carry their pregnancy if they do against their will, and that if we can move forward with SB 436, which we support very strongly, that when it comes to one of the most personal decisions in someone's life, the question of whether or not to continue with the pregnancy and have a child or to end their pregnancy, that it should be up to the pregnant person, free from political interference, free from any type of shaming, and free from punishment. And so we think this is an important step forward, and we greatly support the bill, and thank you for your time.
Thank you very much for your testimony. Are there any questions? Senator Whitley.
Thank you, Madam Chair, and thank you for providing that that context about what happens with other states. You know, we hear a lot actually about how the 24-week abortion ban is, look, we're moderate in New Hampshire. This is what we do. We're just, you know, doing something that other states are doing. But I think that context that you mentioned about, you know, that other states did that first before they moved on to more restrictive abortion restrictions. Did you provide that just to show why it's necessary to sort of stop that before it gets even further?
Oh, absolutely. I see this as an opportunity for the state of New Hampshire to make clear that we feel that this is a fundamental right that everyone should enjoy, all pregnant people should have access to, and we just need to draw a line in the sand at this point. We're seeing this right, you know, taken away state after state after state, with the Supreme Court, you know, unsure of what's going to happen at the court this term. This is New Hampshire's opportunity to say that we believe in the right of people to choose when and if to have a family.
Follow-up?
Follow-up?
Thank you, Madam Chair. Thank you for taking another question. So regarding the question about, you know, what is the Supreme Court going to do? Should we just wait to see what they do? We do know that they have already let an 8-week abortion ban in Texas go into effect. So does that indicate to you the direction where the Supreme Court is going in terms of abortion rights?
Yes, I mean, I'm not going to sit here and predict what the court is going to do or not going to do, but you know, the signs are deeply troubling with what happened in Texas and allowing that to go into effect. You know, I think you've seen a general move, crawl back from Roe over the last couple of terms with some of the key decisions that the court has made. So I do think that it is imperative that New Hampshire get in front of any attempt to crawl back the fundamental right to abortion any further than it already has been. And with SB 436, it gives us that opportunity to do so.
Thank you.
Senator Gannon?
Just a quick question. So you said a minute ago, no one should be forced to carry against their will. Are you including after viability when a baby could live independently on its own, like if Dr. Sherman did a C-section? Are you saying at viability, it's still a woman's choice?
Pre-birth, yeah, I mean, what you just suggested was after birth, but.
No, I'm not saying, I'm saying between when it's viable and birth. You're saying
Yeah.
still at any at that point?
We believe it is the pregnant person's right. Yes.
Thank you.
Madam Chair.
Senator Cont?
Thank you, Madam Chair. Mr. Knapp, I picked up on the exact same statement. Nobody should be forced to carry a pregnancy against their will. Is that your interpretation of what this bill represents, regardless of the temporal time that we've already established, will be conditioned by other statutes?
Yes.
Is this statute truly about just declaring that nobody should be forced to carry a pregnancy against their will, and that's the policy of the state?
So this bill would limit to existing state law, which is the 24-week ban. So obviously we think it should go further. I mean, that's where it's at right now in New Hampshire law. But this is an important step in the direction of ensuring that pregnant people can choose if and when to have a child.
Thank you.
Are there any further questions? Seeing none, thank you very much.
Thanks.
Okay. The chair will call Robert Lacoste.
Thank you, Madam Chair, members of the committee. As I stated in my earlier testimony, I'm a retired nurse anesthetist. During my career of almost 30 years as a nurse anesthetist, I had the occasion to care for 2 young women post-abortion that almost died from profound bleeding. Actions have consequences. Abortions are not without possible very serious side effects. Okay. Other aspects of this this bill, by allowing abortions, most abortions are for unwanted pregnancies versus fetal or maternal problems. At the March for Life in 2020, I saw many signs on the product of rape, or seeing young people in wheelchairs with signs saying, "Thank God I kept this child," you know, a child with disabilities. Mothers saying, "I'm glad I did not abort this child even though I had the opportunity to do it or was encouraged to do it." Most abortions are performed on women of color and or low income. I think we need to consider fetal rights versus reproductive rights. As a nurse anesthetist and as a registered nurse, most of my career, I worked with predominantly women, and I understood what they were going through, even with problem pregnancies, miscarriages, or happy pregnancies. I saw many births that it was just wonderful as a male to see these new babies come into the world. I was blessed to have that, along with my own 3 children. I was there for all 3 of their births. So I opposed this bill, 436. I think there are several organizations within the state that can help women with reproductive rights without abortion, one of which is Options. I don't know where it's located. I apologize, I left the literature at home. At any rate, that's my testimony. Again, I'm in opposition of Senate Bill 436. I'm happy to take any questions.
Thank you very much for your testimony. Are there any questions?
Good day, folks.
Seeing none, thank you very much.
You're welcome.
Mr. Hood, would you like to come forward?
Thank you very much, Mr. Hood. Have a good day.
You didn't even get to sit down.
I'm sorry.
All is fair. Thank you, Madam Chair, members of the committee. My name is Matthew Hood. I'm Vice President of Government Relations at Dartmouth-Hitchcock. Dr. Cass, who joined me earlier today, the chair of OBGYN, had to leave for some afternoon obligations, so you are left with me. I also want to take the opportunity, I think Senator Gannon will appreciate this along with others, is I'm going to be arguing the alternative here, all right? So you just heard on the previous bill what I felt was compelling rationale from Dr. Cass with respect to some of the problems that Dartmouth-Hitchcock providers experience with the Fetal Protection Act, period. So you heard us argue about some of those problems. I'm taking this opportunity to communicate Dr. Cass's concerns. Should you not do anything with repeal, then there's concerns that she has as to why we would support this bill. Excuse me, let me rephrase that. We would support this bill should nothing happen on the repeal for the following reason. Because of the reason that she talked about with respect to recruitment of professionals to the state of New Hampshire to the Dartmouth-Hitchcock program. Her concerns are that without evidence of the state's steadiness with respect to this issue, that providers would be less inclined to come. Now, we have seen that, I think, with respect to Texas, which she has articulated and argued in conversations with her colleagues. And I think she would articulate the concern that that would replicate itself here. That is my testimony. That is the piece that I wanted to share about this particular bill. But I would reiterate the points that I made in the prior hearing. Thank you, Madam Chair.
Thank you very much, Mr. Hood. Are there any questions from the committee? Senator Gannon.
Just one quick question. You said you didn't support this bill. You heard the ACLU man say that he, even at viability to birth, he'd still be in favor of women choosing. Would Dartmouth-Hitchcock be supporting abortion between viability and natural birth?
So Senator Gannon, two issues. Thank you for repeating what was said, because I'm having trouble hearing, so I didn't actually hear what the testimony was. So, but I think I heard your question, which was, does Dartmouth-Hitchcock have a position on viability?
The ACLU just testified that they believe that should this bill pass, the ACLU gentleman testified that between viability and a natural birth, it would still be a woman's choice. And so I'm asking you, is that the position of Dartmouth-Hitchcock, that a woman, it would be her personal choice to decide at 7, 8, 9 months whether to abort for whatever reason?
Yeah, Dartmouth-Hitchcock employs 13,000 people, Senator. We have employees who have very different feelings about the issue of abortion. Dartmouth-Hitchcock wouldn't take a position on that topic. We're taking a position.
You said you support the bill, so I'm just telling you what
which
the
is why
gentleman said the bill meant.
And I wanted to come up to articulate it because it's my support is nuanced with respect to this in light of the previous testimony on the repeal, which we do support.
Okay, thank you.
Yeah.
Okay, are there any further questions? It's always a pleasure to see you, Matt.
It's very nice to see you. Thank you, Madam Chair.
Thank
Members
you.
of the committee as well. Thank you.
Thank you very much.
And legal counsel to the committee. Nice to see you as well.
Okay, Jim Gill. Okay, he's not here. Josie Pinto. Okay. Sarah Matsunaga. Okay, she's not here. And Star Covey. Okay, that is everyone who has signed up to speak. Are there any other members of the public who would like to speak to Senate Bill 436? Representative, you've already spoken. We usually don't allow the going back and forth or rebuttal of testimony, so is there?
I was going to offer an answer to the question in the discussion earlier on in the testimony relative when life.
Okay, why don't we do this, okay? Why don't you generate an email with your response to that and send it to Ms. Horgan, and she will make sure that we all get it.
Thank you.
Okay? Are there any other members of the public that would like to come forward to testify on Senate Bill 436? Okay, seeing none, I'm going to close the public hearing. I'd like to thank the committee members. We've had 2 weeks of late hearings. I'd like to thank our committee secretary, Ms. Horgan, for all her hard work, and our Senate attorney as well for being here. So thank you all very much and have a good evening.
And as always, thank you, Madam Chair, for making sure that everyone feels heard.